അദ്ദേഹത്തിനെ പറ്റി പറയുവാണെങ്കിൽ അദ്ദേഹം ഉത്തരാഖണ്ഡിലാണ് അദ്ദേഹത്തിൻ്റെ സ്ഥലം. BAMS കംപ്ലീറ്റ് ചെയ്തിരിക്കുന്ന ബിഹീവ് ആയുർവേദ മെഡിക്കൽ കോളേജ് ഉത്തരാഖണ്ഡ് ആയുർവേദ യൂണിവേഴ്സിറ്റിയിൽ നിന്നാണ് BAMS പഠനം പൂർത്തിയാക്കിയത്. CCACയിൽ അഗ്നികർമ്മ മഹാരാഷ്ട്രയിൽ അദ്ദേഹം കംപ്ലീറ്റ് ചെയ്തിട്ടുണ്ട്. CCPT ഫ്രം NARIP കേരള, പിന്നെ FCCAP കോട്ടയ്ക്കൽ, CASM കോട്ടയ്ക്കൽ. പിന്നെ അദ്ദേഹം ഇപ്പോൾ വഹിക്കുന്ന ചില പദവികളും കൂടെ ഒന്ന് പറയാം. ഡയറക്ടർ ഓഫ് ഔഷധം ആയുർവേദ ഹോസ്പിറ്റൽ അർജുൻ വേദ ഫാർമസി, സ്പെഷ്യൽ ട്രെയിനിങ് അണ്ടർ വൈദ്യ ഉദയ തൽഹാർ സാർ, എക്സ്പെർട്ട് ഓഫ് അഗ്നികർമ്മം, വൈദ്യ നരേന്ദ്ര ഗുജറാത്തി സാർ, RAV, വൈദ്യ പ്രവീൺ ജോഷി സാർ, RAV ഗുരു, വൈദ്യ VC ദീപ് സാർ, വൈദ്യ ചന്ദ്രകുമാർ ദേശ്മുഖ് സാർ, വൈദ്യ മഹേഷ് ബിർള സാർ. അങ്ങനെ ഒരുപാട് ഡോക്ടർമാരുടെ അടുത്ത് വന്ന് പല കാര്യങ്ങൾ പഠിച്ചിട്ടാണ് ഡോക്ടർ വന്നിരിക്കുന്നത്. അപ്പം നമ്മുടെ ഈ ഒരു ക്ലാസ് പ്രധാനമായിട്ട് നിങ്ങൾക്കറിയാമല്ലോ, നമ്മൾ വിദ്ധകർമ്മം, ഇപ്പോൾ വിദ്ധകർമ്മത്തിനകത്ത് പ്രധാനമായിട്ടും പറയുന്നത് സ്ഥിരാവേദം തന്നെയാണ്. അപ്പം നമ്മുടെ സുശ്രുതാചാര്യം പറയുന്ന പോലെ സയൻസ് ഓഫ് സ്ഥിരാവേദ വി ക്യാൻ യൂസ് അറ്റ് എനി കണ്ടീഷൻ ഓർ ഇനി വ്യാധി. മൂക്കിൻ്റെ തുമ്പത്ത് പോലും എങ്ങനെ നമുക്കൊരു സ്ഥിരാവേദം ചെയ്ത് ഒരു അസുഖത്തിനെ നമുക്ക് മാറ്റിയെടുക്കാം. ഉദാഹരണം കടിശൂല, അവബാഹുവ, ഗൃദ്രശ്രീ പോലുള്ള ഏതൊരു കണ്ടീഷനിലും നമുക്ക് എങ്ങനെ മാറ്റാം. പിന്നെ അതുപോലെ തന്നെ നമ്മൾ അത്യാവശ്യമായിട്ട് അറിഞ്ഞിരിക്കേണ്ട കൈറോ പ്രാക്ടീസുകൾ. പിന്നെ അതുപോലെ തന്നെ വരുന്നത് നമ്മുടെ ഈ പറയുന്ന പോലെ പഞ്ചകർമ്മയിലും നമുക്ക് എന്തൊക്കെ ചെയ്യണം, ഇത്രയും കാര്യങ്ങൾ നമുക്ക് ഡോക്ടർ ഡീറ്റെയിൽ ആയിട്ട് പറഞ്ഞു തരും. അപ്പം നമുക്ക് മാക്സിമം ഒരു 6:30 വരെ സമയമുണ്ട്. ഈ ഒരു സമയം കൊണ്ട് മാക്സിമം അദ്ദേഹം തിയറി പാർട്ടും അതേപോലെ തന്നെ പ്രാക്ടിക്കൽ സെഷനും നമുക്ക് എടുത്തു തരും. അപ്പം നമുക്ക് എത്രയും പെട്ടെന്ന് തന്നെ നമുക്ക് ക്ലാസ്സിലോട്ട് കടക്കാം. അപ്പോൾ കൂടുതൽ ഇനിയും എന്താ പറയുക, ഔദ്യോഗിക ചടങ്ങുകളോ കാര്യങ്ങളോ ഒന്നും പോകുന്നില്ല. നമുക്ക് ഭദ്രദീപം കൊളുത്തി ക്ലാസ് സ്റ്റാർട്ട് ചെയ്യാം. ഓക്കെ, ശരി.
So first of all, big thanks to AMI Mavelikira and Dr. Abhijit sir for organizing this seminar and hands-on training workshop. And now we'll start with the workshop. और सबसे पहले भगवान धन्वंतरी के चरणों में नमन करके we'll start our lecture and उससे आगे बढ़ेंगे. सबसे पहले विद्ध कर्मा पे हम बात करने जाएंगे. सो एनी वन ऑफ यू जिसमें आप में से किसी ने विद्ध कर्मा के बारे में सुना हो? एनी वन? और एनी वन हैव प्रैक्टिस विद्ध कर्मा? सो विद्ध कर्मा इज अ modified form of Siraveda which was started by Dr. R.B. Gokte sir from Maharashtra. Sir degree was GAMS and he was a very practical person. He started doing all the surgeries. He was practicing modern surgeries also, Ayurvedic surgeries also. At that time in GMS, the doctors were allowed to do modern surgeries also and Ayurvedic practice also. So sir did modern surgeries also and Ayurvedic surgeries also. After that, with the invention of anesthesia, जब anesthesia आया, so most of you are comfortable in Hindi. So I'll try to converse most in Hindi and English both, but some part would be in Hindi itself. So सबसे पहले जब anesthesia आया, so it was very anesthesia went to the modern surgeries, and at that time it was very hard to perform surgeries without anesthesia, and for shulagna chikitsa to reduce pain very fast or instant pain management with Ayurveda, sir was able to find something that can give good results and faster results without anesthesia, or you can do something without surgeries. So sir used to read all the books daily and try to apply that practically on the patients. So at that time when sir started, there was a flood there itself in Maharashtra. So sir used to go in the boat and ask everyone that if someone is having problem, and sir used to treat the patients. And at that time anesthesia was not available or very hard to do it without anesthesia. And at that time when sir started doing it, the patients were getting good results. But then sir started reading Siraveda chapter and from Shushu Sahita, and he was wondering that where like in Apasmar it's written you have to do Siraved on Hanu Sandhi Madhya. So is it possible to find a Sira in Hanu Sandhi? No. And in Nasarog, it's written you have to do Siraved on Nasagre, on the tip of the nose. Is it possible to find a vein? So then sir started scrolling different samhitas and different tikas of Dhalan, and then started reading Ashtang Hriday, Mayavati Tika, Himadri Tika of different tikakars. And then sir find the meaning that why is Siraved written if there is no vein. So in Tika it's written if Sira is not seen there, if you can't find a Sira at that place, then also you can do Vedhan, Sira Vedhan at that place, some or the other, how you will get results. Like here, everyone is doing Sira Veda only in varicose vein and skin disorders, not any other disease. So in search of instant pain management or Shulagna Chikitsa, like Shulagna Mahakasaya are there are various different types of Swedas, Upnaha and Lepas described in our text. But that works also very slow. But instant pain relief in a single day, like allopathy does, in allopathy everyone is giving different types of medicines or different types of drugs are invented to get pain relief in a single go. But how is that possible with Ayurveda? So at that time, sir started reading Himavati Tika of Ashtangridha and Dhalan. So in that, sir got the reference of Siraved as Vedyasya iti Veda. In that, it is told to puncture. It is not called Vedan. So from that time, it came out to be Viddha Karma. वेदन करने वाले कर्म को विद्ध कर्मा कहा गया है. And a big thanks to our Guru Vedya R.B. Gokte sir and Vedya Chandrakumar Deshmukh sir. And Vedya R.B. Gokte sir passed away in year 2015. And sir was a very practical person. Before telling any procedure or before starting any procedure or before explaining any procedure to other student, sir used to perform that procedure 1000 times, 3000 times, 5000 times on patient. And when sir started getting results, sir documented all the things with him. And then when he got the results, then he starts teaching. Like in frozen shoulder, if a patient comes to us, we can start with different procedures. But is it possible to get instant result or instant pain relief in that frozen shoulder patient on a first day or on a 3-4 days? So then sir started using Viddha Karma as a procedure. And the patients of Apasmar also came up. And they were also, it is told to give most of the medicine, patient get relief. But in some emergency conditions also Viddha Karma works good. So sir invented the procedure for instant pain management procedures and for other disease also with taking the reference of Siraveda. So moving on, I am a disciple and a student of Vedya Chandrakumar Deshmukh sir, and I have learned from Deshmukh sir, and sir tells different thing and how to manage. And basic thing sir always tell us that first focus on the nidan of the patient, the cause of the injury or cause of the rog, and then only go for Viddha Karma. Viddha Karma is a point-based treatment, but it's not basically a point-based treatment. You need to find the cause of that disease. Like if frozen shoulder is, the pathologies can be different. Manyashul can also go for frozen shoulder. Aghat frozen shoulder also. If the patient pramehi है, तो अगर pramehi patient है तो उस केस में भी frozen shoulder हो जाता है. If the patient is of गंभीर वातरक, then also frozen shoulder can be caused. So in this case, try to find the cause and do with the karma of that point. Like it is written for Vatrakta, you have to do Siraveda from to Angul above Shipramar. So any one of you have done or punctured or put a cannula on Shipramar of hand or of foot? No. The any vein you have put a cannula. So in case of Vatrakt, it's mentioned to do Siraveda from 2 angul above Shipramar. So we used to find out that what comes when I was in NARIP with Deep Chandran sir. We were sitting, but sir asked that what you have learned from other places. Then we were discussing that how Viddha Karma came. Then I explained the same thing that Viddha Karma is written in many places. Siraved is written, but very Sushma Srotas are there. It's always written you can take 50 ml of blood, 100 ml of blood, or you can go beyond that also. But the thing when it comes to how and when, if the Srotas is Sushma, can you take out 50 ml or 100 ml of blood from that Srotas? If you are doing Siraveda from nose, is it possible to get 50 ml or 100 ml? Only 1 or 2 drops can come. So that's why while going on through the tikas, what we find out that Sushma Strotas may less blood will come and big Strotas will give more amount of blood. So like same is the case with Basti. What is the quantity of Niru Basti everyone gives? 1000 ml, 700 mls, right? 1200, yeah. And what is the quantity of Uttar Basti? 5, 10, or maximum 20. Maximum, I haven't heard anyone giving more than 20. So the strotas is small, the quantity is also small. So if you are doing Siraveda from a small strotas, then also the quantity will be very less. And then sir started reading more and more. Then there was a patient of frozen shoulder. So we asked about the history. Earlier we thought that we'll do Viddha Karma for the points of frozen shoulder. But when it come to taking the history or asking the patient what is the Nidan, that patient Nidan kya hai frozen shoulder ka. So the patient got Aghat, and after that Aghat, patient got frozen shoulder. And Aghat leads to the pathology of Vatrakt or Gambhir Vatrakt. So we only did with the karma at the point of 2 angul above Shipramar, and he got results. So it is not a point based treatment, it is only a concept based treatment. Agni karma can be done anywhere, right? Vata Nasti Roja, and where there is pain, you can do Agni karma. But with the karma, you have to be point specific, area specific, and rog specific, and Nidan specific. So try to find out the Nidan and then go for doing with the karma or Siraveda of the patient. So when we were with sir, sir always tell this slok and always tell that there are 2 type of shorre. There are 2 type of people. Those who we call shorre, shorreman. One is you are having a knife and you are killing people. That is also shorre. Or you are having a sword, then you are on a battlefield and you are killing everyone. That is also shorre. And the another thing is that you are having a knife and then you are doing surgeries out of it and then curing the patient. That is also shorre. So you need to decide what type of shorre you want to do. Either take the needle, prick it anywhere, and that shorre is also one thing. You will do marmaghat of the patient or different thing. And you are having a needle, you are pricking it on the exact place, then doing with the karma and then getting results and curing the patient with a single prick or single 2-3 pricks. That's it. So you need to decide what type of Shauryaman Vyakti you want to have. And then it comes to quality of a surgeon, that surgeon should have deep theoretical knowledge. After that, he should perform all the Yogya Vidhis of the procedure and then go for the main surgery, right? Theoretical knowledge is very necessary. We should have Shastra Gyan. Without Shastra Gyan and without knowing exact point and without knowing exact cause of that thing, we can't go and just do surgery. Even in allopathy, we are having suturing pads to practice sutures, right? And most of you have practiced suturing in your UG time itself. No, but most of them, those who have done their UG or PG outside Kerala, they must have practiced that. So even in Kerala, allopathic medicines is not advised. But except Kerala, everyone, every state has a law to practice allopathic medicine. So most of the Ayurveda doctors are doing mixopathy there, and they have the knowledge how to put a cannula there itself, how to put a needle itself, how to do suturing. Most of the practitioners are into allopathic hospitals doing job there, and even most of them are running allopathic hospitals also. So outside Kerala, it's very easy to get a job in an allopathic hospital with a good salary. So now when it comes to their practice, even a laparoscopic surgeon practice it on a dummy. After performing it on a dummy, then they go for the main surgery, and then it take 1 year, 2 year to assist a senior doctor, and then they go for a main surgery. Same this thing is told by our Acharya Sushud, that first go for the practice, learn all the theoretical gyan, do all the yoga vidhis, and then go for the main surgeries, right? So what is Viddha Karma, or what is the importance of Viddha Karma? So like it's written, Bastis Ardha Chikitsa of Kaya Chikitsa, right? So when it comes to Shalya Tantra, it is written, if you have done Sira Veda, you will win half of the role. You can treat half of the Vyadi only by doing Sira Veda, right? So here it comes to the importance of Sira Veda. You can cure half of the thing by Sira Veda, and then go for Shaman Chikitsa, then go for Kriya Kalp, and then you can also go for Panchkarma. Siraved is itself a Shodhan Chikitsa, but if you want to go for Basti, Vaman, Virechan, Nasya, you can go for that, but Siraved is itself a Shodhan Chikitsa. Then going to another shlok, that if you have done Snigdh, you have done Ushna Chikitsa, Snigdh Chikitsa, Ruksh Chikitsa, and Sheet Chikitsa and Ushna Chikitsa. All the procedures you have tried, Sheet, Ushna, and Ruksh and Snigdh, all the things you have done, and then also you are not getting results. Then you have to go for Sira Mokshan or Rakta Mokshan. You will get result in that. So Acharyas have clearly told, if you are not getting result with Sheet Chikitsa, go for Ushna. You have not getting results with Ruksh Chikitsa, go for Snigdh. And if you are not getting results in all the things you have done, then you can go for Sira Veda. And then if little bit of rog or vyadi is left, then last option is Agni Karma. And Agni Karma has different stages. Agni Karma doesn't take the patient from asadhya rog to sadhya. It can make it Shastra Sadhya also, it can make it Aushat Sadhya also. Agni Karma in some cases cures whole the disease, like we are doing Agni Karma in a corn. It can clear whole the corn, and corn at that place will not reoccur. But in some cases we do Agni Karma, it make it Shastra Sadhya or Aushat Sadhya. Then why Sira Veda? So it is written in the shloka, this is in Shushut Sahita, it is written that if you do Sira Veda, first Dushit Rakta will come out, and then Swachh Rakta will come out. So this is the main, if while we are doing Viddha on Shipra continuous for 3 days or 4 days, it's a very small needle. We'll talk about the needle itself. For after 3 days, we can directly see after practicing and after many more time that the color of blood changes day by day. On the very first day when we prick a Sira, then little bit of maroon or slightly blackish colors come. Most of the patient, very dark maroon color comes out of the blood. And then we prick it for 2 days or 3 days, and then we perform all the Shodhan. Then the color of blood changes day by day. So it is practically seen, we cannot say that theoretically, but practically this type of changes come on the patients. Then another shlok comes, when Dushtra comes out of the body, then Sadde Rag Pida Shantir Bhavati. Rag pida, the pain and the inflammation and any pain causing thing get subsides easily. राग और पीड़ा एकदम से कम हो जाती है इफ़ यू आर डूइंग सिरावेदा. दुष्टरक, एज सुन एज दुष्टरक कम्स आउट, the pain and the inflammation or anything which is there itself or any pida the patient is having, it will subside instantly or in few time. So next thing, we can do siraveda now. We know the importance of siraveda or Viddha Karma, but why and where we should do siraveda? So it is written, रोग आदौ परीक्षति, पहले रोग की परीक्षा करो, उसके बाद औषध देना स्टार्ट करो. ठीक है, फर्स्ट यू नीड टू फाइंड द निदान एंड द कॉज ऑफ दैट डिजीज और रोग, देन गो फॉर द औषध चिकित्सा और शस्त्रकर्म और एनी पैरासर्जिकल प्रोसीजर इन आयुर्वेदा. इवन इफ वी आर डूइंग विद्ध कर्म और अग्निकर्म ऑन अ पेशेंट, first thing, we try to find out all the causative factors of the patient, that he is having manya shul or griva shul or any other thing. Then firstly we go for an x-ray, and then we then in further cases then we do with the karma. So first we diagnose the disease, what is the thing, go for an x-ray or go for a pathological or radiological investigation if needed. In all the cases pathological or radiological investigations are not needed, but most of the basic pathological and radiological investigation you should go for. Then it comes to with the Trisutra. First find out the hetu, what is the cause of the disease, and ling, that vyadhi is sarvatantra or paritantra. This is the main thing which you need to focus on, that vyadhi is sarvatantra or paritantra. Why? If a patient is having manyashul, manyagrah, we will go for siraved or points for Viddha Karma. But if a patient is having frozen shoulder due to that manya stamb or manya shul, then what will you do? You will go for the points of frozen shoulder, or you will treat manya shul first, and frozen shoulder will get easily recovered. If someone is having frozen shoulder due to diabetes, if the patient is pramehi patient है, अगर आप उसमें फ्रोजन शोल्डर के पॉइंट करोगे, क्या आपको रिजल्ट मिलेगा? नो. सो फर्स्ट यू नीड टू कंट्रोल दैट प्रमेय, यू नीड टू कंट्रोल दैट डायबिटीज, एंड इन प्रमेय द कंडीशन इज देर इज मोर उत्पत्ति ऑफ क्लेद इज इन इज हाइएस्ट पीक. So at that time Viddha Karma will not work, Agni Karma can work in this condition. So first you have to go for Agni Karma, and after that go for Viddha Karma. So this is how will you define that vyadhi sarvatantra or paritantra, depending upon the causative factor or depending upon the nidan of the patient. After that you have find out that vyadhi sarvatantra or paritantra, then go for chikitsa. In the very first go shaman, shodhan, bheshat, shastra, shar, agni. So depending upon the condition or depending upon the yukti of the vaidya, you can decide what has to be done. Like in the very first go, when the patient comes, I am doing mostly parasurgical procedures also along with shaman chikitsa, but working in a small OPD. When I started, I was having a small OPD of a single room. At there itself, I used to do all the procedures, parasurgical procedure and everything, and I used to run my OPD itself. But where, when and how? Getting results in a small place also you can get results, and then shifting to a bigger place with the same concept you can also get results. So when the patient comes, we start doing it with shaman chikitsa or bheshaj, and then along with that we go for Viddha Karma and Agni Karma. And Agni Karma is a new innovative Agni Karma which was also designed by Viddha R.B. Gupte sir, that where to do different kinds of type of animal. Most of you are doing Agni Karma with Shalaka, Panchalaw Shalaka or Panchdhatu Shalaka. So Gupte sir find out the reference of that Shalaka using a gold Shalaka in an indirect way, placing that Shalaka on a pain area where the pain points are there, and then hitting it. So it will give faster results, and you can do the same Agni Karma for 3 days, 4 days, even 7 days or 10 days. So, but if you are doing it with Shalaka and doing it on a point, and say the next day you can't do Agni Karma on that same point, right? But if you are using that indirect method of Dhatu Sweda with that Dhatu doing Sweda and it's called Agni Karma by Dhatu Swed. So if you are doing that, you can do it for 3 days, 4 days, and patient will get results with Viddha Karma also and Agni Karma also. Gokte sir used to do Agni Karma and Viddha Karma together, and while searching for Viddha Karma, sir started reading Chinese acupuncture points. Why? Because in India, most of our textbooks and everything were not there. The Purna Gyan of our Sahita is not there because Prati Sanskaran of the Sahitas are done after some time by different people. And some of the texts are not available right now, and different Samhitas are also not available right now. So what sir did, sir tried to find Chinese points also, acupuncture and acupressure points. At that time, sir find out different places where the Chinese people do acupuncture. The same places are written in our Samhitas also. So now coming to is acupuncture old or Viddha Karma Siraveda is old? So it is easily we can say that Ayurveda is too much old and the origin of acupuncture is with us. But if we comes to the Kal of Shushruta, Acharya Shushruta, it comes to 3000 to 5000 years ago. So before Chinese acupuncture points, Siraved was there, and there was scholar who came to India, learned from our acharyas, and then went back to China, and then they developed Chinese acupuncture points. If you are searching through different texts or different journals in the internet, you will try to find out that most of the Chinese scholars come to our Nalanda Takshila University. They studied there, or they have been with different acharyas, learned from them, and then they went back to their own countries, and then they started making their own way of treatment. So acupuncture was evolved by a Chinese doctor, and after that it is a part of Asian Chinese medicine. So after all these things, sir tried to sir also used to read all the different books. Sir used to read all the allopathic books also, all the Ayurveda also, all Chinese medicine points, and then sir documented all the things and started doing it on the patient, and then started getting results on the patients. So now what we'll do, Rogi Pariksha. How we'll go for Rogi Pariksha? We'll go for Hetu. This is the main thing. If you are getting the Hetu of that disease, you can go and treat everyone. Like there was a patient, I guess 1.5 years ago, not 1.5, 1 year ago, he was having fibromyalgia, and he visited all the institutes on all the allopathic hospitals there itself in North India. He visited AIMS also, he visited Safdarjung also, and all the allopathic hospital. But no one was tried to find the cause of that fibromyalgia. Like patient was having pain. As soon as you do tail abhyang on tail abhyang, he will get the pain will subside. But as soon as after 1 hour or 2 hour, the pain is again coming up. He was a 13 years old child. Then even I was not understanding what can be the cause. Then I started finding out Hetu, like he's having the same thing from his childhood. When he took birth, after 1 or 2 years, he was just crying. Then we tried to find out his. I had a word with Vaidya Gujarati sir. So sir told, try to find out the cause. You are not finding the exact cause of that disease. So then I find out. I asked the parents that did his mother was having any fever at the time of pregnancy. And after so many questions, and it took me around 15 days to get on to that point, that his mother had fever for continuous 7 months at the time of pregnancy. So it is also written in this case, sir just told to start Vishamjwar Chikitsa, and we did give him, he's continuing his medicine for around 7 to 8 months, and by that time his 60% of problem is reduced only by Vishamjwar Chikitsa and only by finding the Hetu. So this is the importance of Hetu. If you are finding the Hetu of that disease, you can go for that. You can get easy results with only finding the hetu of the disease. Then Purvrup, and then Roop, then Upshe, and then Samprapti. सिरावेदा में एक रेफरेंस और आता है शास्त्रों में, जब हम सिरावेदा करते हैं तो उससे हम संप्राप्ति भंग कर देते हैं, और जैसे ही संप्राप्ति भंग होती है, संप्राप्ति भंग होते ही रोग जो होगा, रोग अपने आप शांत हो जाएगा, और उसके साथ साथ आप शमन औषधि दे सकते हैं. पत्ते पत्ते इज़ द मोस्ट इंपॉर्टेंट थिंग which we are using there itself with Siraveda or Agni Karma or with different things. Earlier we used to give Pathe and Apathe both, but right now what we are giving, we are only giving Pathe. Because if we tell a patient that you have not to eat fried food and the fast food, then patient comes and baked food. Patient comes that sir, I took a pizza and I am dealing 2-3 cups of tea because you only told not to have fried food. You have only told I'm leaving that fried food also and outside food also. I'm taking that and I'm eating homemade pizza. So we only tell the patient to eat this only, and still after that also patient comes and sir, I can't eat this, I can't, can I eat this? So different types of patient comes. And after that rogi pariksha, we go for trivid pariksha, shadvid pariksha, ashtvid pariksha, and dasvid pariksha. This also gives a more clear view about that disease. And then what is the sthan of that dosh of that rog, and then what is the sthan of that rog, and then what is the avastha. After going, next slok comes. So dosh is the main karan of rog. Acharyas have clearly told that you need to balance the dosh, you will get easy results. Then we come to dosh avyav utpatti. So when it comes to yakrit, pliha, fufun, unduk, you can see most of the diseases or most of the avyav are getting dosh, which is the main dosh, it is rakt, shonit, in most of them. So if you are doing winning that shonit itself, if you are taking out the dushit rakt itself, you will get results. So this is the main importance of dosh avyav utpatti, in what type of dosh you can go for, dosh or avyav you can go for rakt nisaran or rakt mokshan or sira mokshan to get results. Only what is required is yukti. So where Agni Karma can be done and where Siraveda or Viddha Karma can be done. If the disease is on Twak, Rakt or Mas, you will go for Viddha Karma. And if you go for Sandhi, Asti and Snayu, we will go for Agni Karma. And then it comes to why Siraveda or why Siraveda gives good results. Like Pitt is the main dosh, but Acharya Shushud have considered Rakt as the fourth dosh. So if Pitt and Rakt, Pitt is getting doshit, Rakt will also get doshit, and Pitt and Rakt are directly proportional to each other, right? So same is the case with Sira and Kandra, because Rakt is flowing on Sira and Kandra. So if we take out that Dushit Rakt from Sira, we will get results. So this is the importance of doing Siraveda. And then again it comes, is Vyadi Sarvatantra or Paritantra. So this is the main thing which sir always focuses on, that why you have to go for Sarvatantra and Paritantra while doing Viddha Karma. Most of the cases, even I had a patient who did Viddha Karma from 4 doctors for his frozen shoulder, and he was not getting any results. Even he did Snehan Swedan, but after what I asked him कि कहाँ पे करा था, all of them were doing it on the points of frozen shoulder. But I took his brief history, and he was also having aghat. Then we only did with the karma at 2 angul above Shipra, and he was able to lift his shoulder. So this is how you can get results easily with the karma, only by knowing it is the Vyadi Sarvatantra or Paritantra. Then now we'll discuss that is Vyadi Sarvatantra or Paritantra, or in which condition you have to do. Like patient is having Manyashul. What can be the cause of Manyashul? Amlapitta Janne, Aghat or Dhatushay Janne. If you are doing Viddha Karma for Manyashul due to Amlapitta, would you get any results? If you are not treating that Amlapitta? No, we won't get any results. So we have to treat that Amlapit along with Viddha Karma, then only we'll be getting results, or else no results. So this is the main thing why you have to find out is Vyadi Sarvatantra or Paritantra. Then Aghat Janne. In Aghat also it is told to do Siraveda from 2 angul above Shipra, because it leads to pathology of Vatrakta or Vachonit. So you will do only Siraveda or Viddha Karma from 2 angul above Shipra Mar. And then Dhatusha Janne. Is it required to do Raktamokshan and Dhatusha Janne Vyadi? We can't do that because patient is already on Dhatusha. But in this case, what we need to do? Bhrangan is to be given. So this is the main thing, that why you are not doing with the karma on Dhatusha Janne Vyadi. But most of us, like we are also doing with the karma and Dhatusha Janne Vyadis, but why? With the karma, the needle is very small. We are just pricking a very little part of that. But only if the pathology of Rakta comes. If Rakt is also getting Dushit along with Dhatush hai, then we'll go for Viddha Karma, not proper Siraveda. Because in Dhatush Janne Vyadi, if you are going for Siraveda, you won't get any results. Patient will get more and more weak. But along with Dhatush Janne Vyadi, if there is involvement of Rakt, you go for Viddha Karma, you will be getting results. Because we are just taking a small prick at that point and only a drop of blood comes out in that condition. So you need to decide where to go for Viddha Karma and where to take out more and more blood, like of Siraveda. Then coming to Katishul. Katishul can also be of different types. Amlapita Janne, Aghat Janne, Vishtabda Jeen, Arsh, and Pandutva, Vyavsaya Janne, Dhatushay Janne, and due to Anyavikar. So let us first discuss Amlapita Janne. In the case of Amlapit, if you are doing Viddha Karma, you won't get any results. Why? You have to treat Amlapit first. And then you can go for the points of Viddha Karma. And along with that, you have to follow the Pathe and Apathe. And then again, Aghat Janne. If there is a fracture of spine, then would you get any results with that? With the karma? No. In Aghat also, then we need to find something different. Or we need, the patient needs to be healed from that fracture. And then you can find if the pathology is coming different, then you will go for the karma. Then due to Vishtabda gene. I guess 80% of the patients who are coming for Katishul have constipation. More than 80%. Like 10 patients are coming, 9 are saying that, sir, I am constipation from past 5 years, 10 years. And the 10th one who is coming, sir, I got, the motion is clear, but I am not that fresh enough. So most of the patients are coming from Vishtabda gene or Malavashtam. So we need to follow that also. And in the case of Arsh, if the patient is having Arsh, you have to treat Arsh, and then you can decide if the condition needs, or your Yukti decides that is it needed, then go for Viddha Karma. If your Yukti is not allowing that not to do Viddha Karma, then don't go for Viddha Karma. Like I was discussing when we were at NARIP Chirudurutti, I decided that we'll do Viddha Karma of only frozen shoulder. But then instantly my mind struck up that just go first go for the whole detailed diagnosis and finding out the hetu. So it was Aghat Janne. We only did point for Vatrakta and we got results. We didn't prick the on shoulder or any other place. We got result only by pricking the points of Vatrakta. Then Pandutva. In this case, already Rakt is not there in that quantity. And then if you are doing Siraveda or Viddha Karma, more loss of blood, right? So in this case also you have not to go for Viddha Karma. And Vyavsaya Janne. If the patient is a daily wage worker or he is a athlete, most of the deadlifters or weightlifter are having back pain. 90% of the lifters are having back pain, those who are lifting very heavy weight, or most of them, those whose muscles are not that strong enough, they are having back pain. And Dhatu Shaya Janne, again you have to select whether it's the involvement of Rakta is there or it's only Dhatu Shaya. Then Anya Vikar can be many. Then Brahm, due to Vidagdha gene, Kaf Kshay, Majjavasroto Dushti, and Raktapitta, due to Raktapitta. So in all the cases, if you are going for Siraveda, or you have to find the cause of that Brahm and then only go and prick that point with Viddha Karma. In Brahm, most of the people says that not to go for Siraveda. Even Sir also tells that not to go for Siraveda in case of Brahm. But you can go for Viddha Karma in case of Brahm, it gives good results. Now coming next, Gambhir Vatrakta. So patient with history of LSCS, history of spinal anesthesia, after hysterectomy and no Sutika Paricharya. The female patients who are coming after not getting proper Sutika Paricharya, they will definitely have that Gambhir Vatrak condition also and back pain also. Sutika Paricharya is that important in all the cases that if patient is, the females, they have got the delivery 1 year ago and still they are having back pain. One can be due to use of LSCS or spinal anesthesia. Third is Sutika Paricharya is not done properly. There itself in north and all the other parts, what people does, they take a rest for 10 to 15 days and then start going for the work. So this can be the main cause of Gambhir Vatrakta also and Katishul also, Katigraya also, or some patient comes with Grudrusi like symptoms. Then also the main cause we find is Sutika Paricharya. Then we have to go for the treatment in which if Sutika Paricharya is not done properly, then we have to go for that treatment. Then Swaskas. Swaskas में ज्वर, क्षयजन्य, रक्तपित्त उपद्रव, वातस ग्रहणी, पांडुत्व, अर्श, post COVID symptoms is the main cause of Swaskas right now. Around 50% of people of Swaskas who are having post COVID syndrome, they are having problem with breathing problems, and I guess most of the people, those who got COVID, and after that the problem with them is they are not getting smell. Is there anyone? Loss of smell is there, and some people are having loss of taste also, and along with that fibromyalgia is also there. So in that case jwar needs to be treated. Then it comes to Viddha Karma. Why sir gave the name Viddha Karma in the condition? सूची द्वारा वेदन करने को विद्ध कर्म कहा गया. द डिस्क्रिप्शन इज देयर इन हिमावती टीका ऑफ अष्टांग हृदय एंड इट इज ऑल्सो गिवन इन डलन टीका. एनी वन ऑफ यू हैव गॉन थ्रू डलन टीका? सो इन डलन टीका it is there only in Hindi or Marathi itself. English it is not translated Dalan Tika. So when we go through Dalan Tika, we find different, like I was telling about the strotas, where the small strotas is there, go for small prick and only small blood will come, only 1 or 2 drops. If the strotas is big, blood quantity will anyway increase, right? So there are different places it is told that why Suchi has been taken. Surgical blade can also be taken at that time. Suchi was selected because it can be precised. You can use 11 number surgical blade also, 12 number surgical blade also. It is very helpful in varicose veins. Deep sir is also using that classical Siraved method in varicose vein, and it looks also very good. But when we are going for that Suchi, sometimes blood also doesn't come out. And it is also told in our Shastra and Tikas, if blood doesn't come out, then also you have to prick and take it out. Blood doesn't come out, it is okay, but prick the area. In some cases, when we prick, in most of the cases, only a single drop of blood comes out, even in Shipra Pradesh also. Like yesterday, we did Shipravid of Dr. Binoy sir, and blood didn't came out. Only a single, that not even a drop. Very little blood came out, even after pricking on the vein. Sometimes blood doesn't come out. So it is also given, if blood is not coming out, it is Vayu that comes out in Adrishya Roop, because you can't see Vayu. It is Vayu coming out in Adrishya Roop, right? So what is the meaning of Viddha? Viddha means Chedan Karna, to prick. Then where the Varnan comes off, the Varnan is there in Sushut Sahita, and the detailed explanation is there in Dalan Tika also and Himavati Tika also, right? And for where it is used, शूल को कम करने के लिए, for instant pain management it is used. And then Vyadhi. In Shushu Sahita it is also written in Vidriddhi and Udarpatan and then Vriddhi. So it is written for the treatment of ascites, that you need to prick the area with the needle, take all the fluid out, and then do Patbandhan. So it was, the shlok clearly describes in detail, and in Dalan Tika it is more brief, detailed in explain that how to do that pricking, and how to take out that fluid out, and then do Patbandhan. And you have to only, you don't have to drink water, you have to go for is that Godugdha and other things in which water is not there. And if you want to drink water, take water only by drops, only 3 drops, 4 drops, 10 drops. It is written, and it is practiced for the case of Vidriddhi ascites. It is practiced in Maharashtra. Like most of the patient, the thing it is now also practiced there. Then coming to important points before doing Viddha Karma. So first is Shastra Gyan. You need to be precise of all the theoretical knowledge, and then go for Yogya Vidhi. We'll be performing Yogya Vidhi, and then holding the needle. How to hold the needle? Because holding a needle in a perpendicular way. So we'll be doing this afterwards, like how to hold the needle. Needle is to be holded on a perpendicular way. The angle of pricking should be 90 degree. If you're pricking it by 45 degrees or 10 degrees, you won't get any result, because the srotas will move here and there. The vein can also move here and there. Proper counseling of the patient. Like here, if you are doing a prick to the patient, it's very hard. Even when I started doing with the Karma, it was very hard to convenience a patient that how will you treat it by a needle, right? So when we started doing with the Karma, the patient said, no sir, sui chubegi, we won't go for that. But counseling and convincing the patient to go for Viddha Karma or Siraved is the most important thing. And while we were in Deshmukh sir's OPD, the OPD starts at 12 p.m. in the noon, or 11:30 or 11 o'clock in the morning, and it gets over by night 2 a.m. or 3 a.m. Even if you go there at 12 o'clock at the night, 12 midnight, then also hundreds of patients are standing still there. So maximum OPD was 1000 plus there itself, only for Viddha Karma. And it is a very small room. This is a very big room. I guess 1/6 of this room is the OPD of sir. And even outside also, if you go at night, you will find that there are any trade fair or something. Most of the people are standing outside, and the room only sir is sitting there, patient is sitting there, rest all students are there. There itself, in a day, more than 300 students come to learn from him. And even most of the medical officers, and they come and they learn from it, sir. But the problem is that only patient is sitting there, and rest all the crowd is of doctors. and even patients are coming there in the morning and getting their number after 6 hours, 4 hours. This is the power of Ayurveda, and this is the power of Siraveda and Viddha Karma, which by which patients are waiting. And even most of the allopathic doctors are getting their treatment done by Viddha Karma. Even sir practices Viddha Karma in infertility. I am not practicing that, so we have not included that, Viddha Karma in infertility here. And sir is also practicing in psychosomatic disorders and different types of sir is practicing it in hair fall also. We will be doing that here itself, but the topic we had selected here is of instant pain management only. How would you manage pain and other little bit of disease? So, and then it comes to position. So when it comes to position, if you are doing Viddha Karma, it is told that Janu se 4 angul upar and Janu se 4 angul niche for Grudrusi. And for Vishvachi, it is written Kurpar Sandhi se 4 angul niche and 4 angul upar. So how will you go for that? The position of pricking is very necessary. So it is a 90-degree angle for Grudrusi that make the angle of legs by 90 degree. Then only if you will prick, then only with this proper. And then if you are doing for Vishvachi, then only go for semi-flexed and semi-extended position. Right? So after proper counseling, you need to sign up consent form itself. Consent is very necessary because after doing Viddha Karma, some of the patients who are having delicate skin, they form a bruising effect or some clot of the blood is there. And even when we are doing Viddha Karma, the blood oozes out very fast. So there's a popping out of a vein. So it also resembles within half an hour or 1 hour. But proper consent is necessary in that case. Then what is the size of the needle? This is the size, and why Gupte sir decided this size itself. So sir, you took basmati rice. You are aware of basmati rice, that big one, mandi rice, I guess. Here it's. So the size of that yav is equal to this needle. The needle size is 26 gauge by half inch. The size of the needle is half inch and gauge is 26. There are different sizes like 26 by 1, 26 by 1.5. Different sizes are there, but this is the perfect size for doing Viddha Karma. And even in small kids also you can do, and even in old age patients you can do, because when the child is born, there itself in allopathic hospital, firstly injections are given. So it is a pediatric needle or diabetic needle. So we can use that in kids also and infants also. Not infants, but 1 year, 2 year baby. Sir is using that in 1 year or 6 months kids also, or in case of pediatric. And I guess more than 800 babies are there itself of infertility cases. Babies are there who are born by Viddha Karma. So next, if you want to go for deep penetration, then you have to go for 24 number needle. Like in Gurdusi, we prick 1 angul or 2 angul away from sciatic notch. So this is also used, but here how we prick on a angle or 45-degree angle, or if you are pricking it by 90 degree, then you have to go towards the umbilicus. Next, depth of Viddha Karma. For Twak, half vrihi, Mas, 1 vrihi, and then Sira, Asandhi, Asti, Snayu, you will go for 6 to 10 vrihi. And first, this vrihi praman, we all will be doing Yogya Vidhi. Every one of you will practice it in, like Yogya Vidhi is told in our Shastra, you have to do it on fruits, vegetables, on chicken pieces or itself. So we will do different types of on different like cucumber we'll use a banana itself, or apple, or potatoes we'll use. So everyone will do Yogya Vidhi, and then we'll go for the main practical itself. So Shipra, why Shipra is given more importance? So Shipra संख्या is 4. 2 शिप्र हाथ में है and 2 शिप्र पैर में है. And if aghat of shipra is there, akshepam marnam cha. इट विल गिव्स यू कन्वर्जन्स, और वात की इतनी वृद्धि हो जाएगी कि उससे कन्वर्जन्स आने लग जाएंगे, आप शेप पर कम. So any of you can tell me a death which was due to aghat on Shipra? Right. हाँ. So Shri Krishna left his body by the aghat on that Shipramar itself. The arrow hit his Shipramar, and by that arrow Shri Krishna left his soul there. And another death due to marmaghat. Duryodhan. Marm. Vitap was mainly done. And another one is Ravana. Nabhi Marm. So these are the main deaths of by marmaghat. So you need to be very precise for doing Viddha on Shipra itself, and Shipra can give you many benefits. Only by doing Viddha on Shipra, if you can't understand anything, you can go for Siraveda or Shipra itself, or with that Shipra itself, you will be getting results. And where you can, in which Vyadhi or which Rog you can go for Shipra with Pada, Padharsh, Chip, Visarp, Vachonit, Vatkantak, Vicharchika and Paddari. And in the case of Visarp, I got an insect bite, and I was having that Visarpvat Pida. Then I called Gujarati sir also, and Deshmukh sir also, that sir, I got this problem. So sir told that do Siraveda by 50 ml, you will get results in that period of time also. Some insect bite was there, and I was having very much dahavat pain there itself. So after doing Siravet from Shipra, it took around 50 ml of blood from my Shipra. I didn't did Viddha Karma at that time. I took a cannula, inserted a cannula, and took out around 50 ml of blood. So after that, within 1 hour, my pida and daha was subsided, just by doing taking out around 50 ml of blood. So you can do in many cases, like in Vatkantak. Vatkantak, you need to find out the nidan of that Vatkantak. Is it due to Grudrusi, like Gridrusi, or is it plain only Swatantra Vatkantak or Patkantak? So you need to decide and then go for doing Viddha Karma at that place. So now we'll discuss about the points. After doing Yogya Vidhi, then we'll go for, we'll select different points, and then there are different slides for each and every point. We have selected around 15 rog for doing Viddha Karma. Each and every rog we'll discuss here itself. First we'll do, sir, break. हाँ, so sir ने बोला है कि अभी टी ब्रेक के लिए रुकना है. And after that we'll first do Yogya Vidhi in all the different cucumber also, and leaves are also there, potatoes are also there, and oranges also there, apple, everything is there. We'll do with the karma on that structures. We'll perform the Yogya Vidhi, we'll get our perfection in that thing, and then we'll go for the patients. So any one of you who is having any pain or thing can volunteer. And others, they have not used a cannula or a needle. So for everyone, what we'll do, everyone will try to break a needle on themselves itself. But before that, we'll go for Yogya Vidhi, right? So Yogya Vidhi described by our acharyas has to be done on fruits or on vegetables or on chicken piece, right? And how many of you have performed Prachan Karma? Most of you. So same we'll do that. First we'll do Viddha Karma or Siraveda, and then we'll go for Prachan Karma. In the cupping session, we'll go for blood cupping itself with Prachan Karma with the surgical blade. So we'll do Yogya Vidhi of that also, and we'll first go for Yogya Vidhi of Viddha Karma, right? So first thing comes, how to hold a needle, right? So this is a 26 by half needle. Everyone got the size. You can it only cost the box costs only 120 rupees. Only the needle will cost you 1 rupees 20 paise. That's it. And with this needle only you can treat a patient. Right. So first, how to hold a needle? Always open the needle in front of the patient, or never ever use the open packet. Even if an open packet is there with me, I never use it. If I feel little bit of on that, it might be used, so never use that. Take a fresh needle every time. So we'll take out the like this. So best way to hold this needle, like you will be pricking it perpendicularly, right? So perpendicularly pricking a needle, finger facing downwards, thumb facing perpendicularly, and hold the needle like this. So this will fix. Needle won't move. Only with the movement of your thumb and index finger, it will move, or else it will not move. And if you fix it in this way, it won't move. Right? Fix it, it won't move. It is fixed. So this is how to hold a needle. This was firstly done by Gokte sir. Gokte sir did hold the needle, or tried it all in a different way. But this is the best way to hold a needle, so it won't slip off from your hand, or your balance will not be disturbed. After that, on while pricking on a patient, what is the praman? How much you have to prick? Half vrihi, 1 vrihi, or 1/4 vrihi. Where you will go for 1 vrihi, where you will go for half vrihi, where you will go for 1/4 vrihi. Like 1/4 vrihi, if you are going to prick on the patient forehead, so can you go half vrihi? Around the size of this needle is 13 mm. Nearly we take it as a round off, or by 12 mm. 12 mm is this place. Can you prick 6 mm on a patient's forehead? Is it possible? No. So there we'll go for 1/4 vrihi, only this much. And now the question comes: does it prick smarm point? So if you are pricking 1/4 vrihi, it will not go inside the marm. It will go superficially, only inside that vein which is told by Acharya. So the main point comes: if you are pricking Shipra marm, right? So what is the size of this needle? Size of this needle, length of this needle, 12 mm. And if you measure the place, Shipra marm is not this side, it's located on this side. So if you are going to prick half vrihi inside, it won't hurt Shipra marm. It will only go inside that vein. So anatomy is very necessary in this case. If you are read anatomy and have practice surface anatomy, and you have learned it very clearly, then there is no problem while going with the anatomy. But sometimes what happens, what everyone now, most of the people who have learned with the karma, but they are not point specific. They just take the needle, prick it on any point. That won't give any results. Only pricking on a specific area gives you results. Like you are pricking it on cephalic vein, right? In Vishwachi, it's written Janu Sandhi se 4 angul niche और 4 angul ऊपर. The vein which is there, it's cephalic vein. If you are going to prick it on this place, it won't give any results. Only pricking on cephalic vein will give you results, right? Everyone got it? Any questions or any doubts till now? Anyone? Or holding the needle, exactly where to prick. This is only point based, but exact point has to be pricked, or else you are pricking it on any other side. If lateral, you have to prick it on the lateral border. If you are pricking it on the medial border, would you get any result? No. So exact vein has to be punctured, but it depends. The needle size is very small. The crossing area, the tunnel is very small. Sometimes blood comes, sometimes blood doesn't come. And as soon as you take off the needle, little bit of blood comes, right? So now how much to prick? The praman is Vrihi praman, right? Vrihi praman simplified. Sir used to measure it by vernier caliper. Sir took vernier caliper to measure the size of that yav or Vrihi, it size of basmati. So it was around 13 mm, and size of this is also 13 mm. If someone is having vernier caliper with them at anywhere, they can measure it. The exact size is 13 mm, and exact size of it, if you are taking 1000 yav or basmati rice, and then you are checking the size, the total round off or center point will come out to be 30, right? So we are pricking 13 mm, okay? And on the for deep penetration we go 1 Vrihi, for superficial or half penetration we'll go for half Vrihi, and on the forehead or any other places which is the marm are located nearby, so that place we'll only prick 1/4 Vrihi. On nasa agre we can prick it half Vrihi also, right? But if you are pricking it on the apang sandhi, apang keshant sandhi, bhru puch, bhru madhya, then you will only go for 1/4 Vrihi, that's it. Because if you are going deep inside, it will needle will touch the bone. So you have to be very perfect. Holding the needle is very perfect, and the balance of the needle, it is also very perfect. So now everyone is having potato with you, right? Now what we'll do the practice that how to prick it on the patient, right? So your fingers will support. Like if I want to prick Shipra, so I'll take the hand of the patient, then take the support of my fingers and hold the needle in this way. See, my fingers have taken the support. If I am going, I'll go straight down inside the vein. But if I am doing it like this, my hand can move this way. Take the support. After taking the support, then prick. If you are not comfortable while pricking standing, always a Vaidya should sit on a chair of the points. See, here you can use the table itself. Keep it here. Take the balance. Balance is very necessary, because if you are going to prick, to be perfect in anatomy also and pricking also. See, right? When you are pricking it on this area by holding the needle, see, my index finger and other finger is holding the thumb. I am pricking it on this way. Then also it's going perpendicularly. And when I am holding it this way by fixing the needle, then also taking the support of my finger, then I will prick, it will easily go inside. The another thing is that how will I control this, right? My fingers are controlled, okay? So when we are going to prick, see, on Arpatra, I kept the needle on the surface of the skin. Don't prick it on the very first time directly inside. Place the needle on the screen, right? So जैसे ही हम निडल को प्लेस करेंगे, जो पेन पेशेंट को होने वाला निडल का वो चला जाएगा. We won't feel any pain, and then after placing the needle, then we feel, right? So here is a apple. We have placed the needle on the skin, right? Superficially touch हो गया. The needle is so fine that it will superficially cross the skin, uppermost layer of the skin. After that, the needle when you put that's it. It is very point specific also, and another thing is that it is time specific also. You just prick and come out. See, proper 90-degree angle, prick it and out. So the fingers, support of your fingers is necessary, just because it will not allow you to go 1 Vrihi. See, if I want to go only half Vrihi, only this much will go, because your finger will not allow you to go beyond that. So this is the use of while you are using your fingers and then pricking, it is necessary, just because it will not go more deep inside. The exact location is only exact place or exact vein or exact location will only be pricked. See, now what sir used to do, sir used to take Ark Patra or Arand Patra or different type of Patra. You will just close your eyes and place the needle on the skin. Now you will feel different layers of the skin while pricking it on the patre. See, I pricked on 1, 2, 3, 4, 5, 6. I pricked all these while closing my eyes. So every one of you will practice while closing your eyes, and then you will feel the layers of the skin. Right? Same is the case with patient. When you are pricking only by sparsh, you won't see this, but your sparsh will feel. See, even my eyes are open, then also I can feel different layers. Same is the thing with skin. Like when you are pricking a needle or a cannula, your hand will easily feel that force. So when you are pricking, your hands will easily feel that force. Like if I'm pricking a cannula on a vein. So while pricking, while on a 45-degree angle, I've placed the cannula like this, and then I'm going. I'll feel different layers. So when I've pricked the layer, I'll feel it, or when I've pricked the vein itself, I'll feel it. So that's why doing with the Yogya Vidhi on Patra is necessary. Done. After that, different surfaces are there. Like some places hard, some area is soft, right? So in this case, what we'll select? We'll select the potato. Okay. And now we have placed the needle superficially. In this way also you can place, and this way also you can place. See, you have placed the needle, prick it 1 by 4th vrihi. This is half vrihi and 1 vrihi. So first I'll prick 1 by 4th vrihi is this. Then again we'll go for what? Half vrihi. It's this. Done. And now we'll go for 1 vrihi. So 1 vrihi is place the needle in this way. Your hands are supporting it, and then this was not perfect. Take a support, hold the needle on 90-degree angle. So that's perfect. Only 11 mm has gone inside. 11 to 12 mm. Not whole needle is inside. So you need this much of perfection, and this much of perfection will come by Yogya Vidhi itself. See, and now what we'll do, we'll prick first 1 vrihi. So 1 vrihi praman is this. You can see the needle little bit inside. Then this is 1 vrihi. Now we'll go for half vrihi. This is half vrihi, and then after that 1 by 4th vrihi. Now what we'll do is, every one of you will prick first 1 vrihi. Everyone hold the needle like this. Take the support, then prick 1 vrihi. Take a support on the skin, right? One support on skin. First place the needle on the skin, then prick it. It will go very easily deep inside. But if you are pricking it, it will cause pain to the patient. Done? Then half vrihi. And then 1 by 4th vrihi. Superficial prick only. Right? Now we'll try this on cucumber. Why? Because of different types of skin. So everyone will take a cucumber, and then they will try, and half of you can try it on apple itself. Like the skin and you are pricking it on a leaf, then also it's very light. Now, after that, how will you select the skin layers? 1, 2, 3, 4, 5, 6, and then 7. Layers are ready. Do you feel the difference by breaking on different structures? So this is the main thing, like different you are working on different structures. That's why you will feel the same different structures on your skin also. Like if you are puncturing it on Hanusandhi, you will feel a different structure and different pressure. If you are puncturing it on forehead, you will feel different pressure. And then if you are puncturing it on Chipra, you will feel different pressure. So that's why different things are used to give different pressure. हाँ कर सकते हैं. एप्पल आप कैसे भी कट कर सकते हैं. लाइक वी आर यूजिंग चिकन पीसेस टू डू अग्निकर्मा. Doing Agnikarma in Qadar is very easy. Within 2 minutes, you can remove that core, but only with perfection. It takes only 2 minutes, and after that, after doing Agnikarma on Qadar, it doesn't reoccurs if you have done it perfectly. And no use of anesthesia is there, no use of any substances there. Only Agnikarma, and then we fill it with chuna, lime, edible lime. That's it. It works as a char. Corn. Corn. Only doing Agnikarma can it takes only 2 minutes, but it depends. You are having an OT, and then you take time, because when you go to a modern hospital, they admit the patient for 2 days, then do. And then the bill is of around 13,000, 15,000, 20,000, depending upon the hospital, right? It works as a char. So the thing, edible lime. So the particle or the some skin or part of corn is left, it will be removed by that chuna. So when sir used to teach us, we were with Talhar sir, and sir used to teach us. Sir, in a very simple way, sir used to tell us, इसको जलाने का और चूना भर देने का. So now everyone has practiced. Done. So now we'll break one vrihi again in a very fast way. Hold the needle, prick it one vrihi. Holding the needle in this way, take the support of your fingers, place it here, then prick. Take the now prick.
Sir, in patient body,
Yeah.
how much time you have to hold that?
So we'll prick it and take it out. Only if you are puncturing a vein, like we are pricking it. See, my vein is visible. So if I am pricking and the blood is oozing out, then we can place the needle for around 1 minute, 2 minutes also. But sir did it from his yukti, है ना? So if you are pricking Hanusandhi, you can place the needle for 1 minute, 2 minutes also. But after pricking, if you are taking the needle out, then also if the vein is punctured, the blood will ooze out, or else the blood will not ooze out. The thing, simple concept is that adrishya roop mein vayu will come out, and it has a reference in Samhitas, right?
Sir, where we prick here, expert, which way here, we cannot miss.
We'll discuss this. Place it. First, we'll hold the needle in this way or this way. Holding the needle is the main thing. Now place your finger, take the support of your finger, place it on the skin, and then prick it. Take the support of your finger proper perpendicularly. Now prick it. Right. No pressure is needed. Needle will go automatically inside. No pressure is needed. Only a little bit of pressure will prick the needle. Done. Place the needle. Not very fast. Place the first. Place the needle on skin. After that, you will prick it inside. Place the needle on the skin. Then prick it. Place the needle like this. Then prick it. No force is needed. Very gentle force for prick this. Very good. Place the needle on the skin. Then prick it. This was half ring. Wonderful. Half ring. Half ring. Little bit. Then one ring. Perfect. You can remove it after. Place the needle. No, not instantly. Place the needle on the skin first. Then so that's why fingers are being used. Take the support of the and now you can place the needle on the skin. Now prick. Very good. Place the needle. On the skin. Now place the needle. So you need to create a control like this. Place the needle, prick it inside, and then you will take it out. Place the needle, don't leave the needle, right? You can hold it like this also and take support of your index finger for a moment. If you are holding it like this, you can hold it like this, take the support of your finger, place it on the skin, then prick it, and then you cut it. If you are pricking it on then you can place the needle that will pull out easily and then you can pull it after. Fast it can be slow. Place the needle, prick it. Place your hand, take the support of your hand first. Then, not directly place it on the skin. So it won't cause any pain to the patient. If you are directly pricking, the twitching pain would be there. And after that, what patient will say, my pain has, other pain has gone, but needle pain is not there. So that's why just place the needle in this way, then take it and then of cucumber with the needle. Who is not having? If you want to remove any foreign particle from the skin or any area inside, this will help in that case. Don't trick it inside. Slightly. Then you will prick on the opposite side of the orange skin. Place the needle, then prick it. And while pricking on the opposite side, you will feel this as the same of the human skin. It will penetrate and different jerks will come with the needle, and from that you will feel that how it works. Now anyone, any queries or any questions till now? Any confusion? And for doing prachan karma with the needle, what you will do, slightly place the needle tip on the skin and just scrape it very gently. This can be done on Sukumar Vyaktis also. It doesn't give any pain to them. It just looks like someone is just scratching.
For whether it comes any bleeding?
Bleeding comes. Capillaries are there. Have kept the needle. Small scratches are there. Blood will easily. Apply the tip of the needle on white place. Blood is coming. It just feels like blood superficially, and blood will easily ooze out. You don't need to go deep inside. No need of going that deep inside. Only scraping the blade or only scraping the needle with on the skin will take out the blood. No need of doing taking that insulin needle or that lancet to prick inside. Most of the patient feels that the doctor is giving too much of pain with that needle, but if you're scraping, patient won't feel any feel. It just look like someone is scratching. That's it. And the same good amount of bleeding is also there in that condition, also in that condition also. Please the needle gently. See.
അങ്ങനെ ചെറുതായിട്ടൊന്ന്
Only go from down. You first cut the lower area, then go on the upper side. Because blood इधर से निकल रहा है तो नीचे आएगा, बाकी एरिया को कवर नहीं करेगा, तो बाकी एरिया जहाँ पे आपने प्रच्छांकरण करना है, that would be visible very easily. So you can do प्रच्छांकरण on all the way. By cupping, wet cupping, or rough motion. You will take the blade and your speed should be very fast. Only just touch the blade superficially. Done. And do not prick it deep inside. No need of pricking it deep inside. You have to just place the blade, surgical blade like this, the tip, and just move it very gently. No need of pricking it inside. The patient will feel only a scratch is being done on their skin. Just tell if the patient is not ready to do that. Tell the patient if he is coming with anyone, tell it we are going to do this procedure, explain it to them if it's necessary. Then just tell the patient we are scratching a pen on that to check your sensations. We just do it from up to down, up to down, up to down, and then after that what we will do, we place the cup on, blood will ooze out easily. Now wiping off in the same direction you have scratch it this way, so you will wipe it off on the same direction. In this way bleeding will stop instantly. And if you are wiping it from the opposite direction, the skin which is being cut, that will open more, and then bleeding won't stop. You can try it on your cleaning itself. If you are wiping it out, the bleeding will stop, and bleeding won't stop if you are wiping it off on opposite direction, right? So first thing, you have done it with surgical blade. Why 11 number surgical blade is necessary? See, you can feel the tip. Only touching the tip can scratch the skin. But if you are pricking with the 12 number blade, patient will feel the pain, right? Why? Because it will go inside the skin. It will cut superficially. That's all. Now you can hold the blade like this, surgical blade like this also, or you can use a blade holder. The blade, same blade holders come for 11 number, or else you don't want to use that surgical blade holder also. You put the surgical blade on opposite direction, fold it on this way itself and on this way itself. So your surgical blade holder is ready. Now pricking will start. Right? You can easily prick. It works like just like a pen. So now everyone will take off their surgical blade. No need to give pain to the patient. He is already in pain. How to open a surgical blade? This is a small opening. You will open it like this. The blade is here. You will take it out Then put the opposite side of blade inside. Right? Fold it in this way, and then the side surfaces, जो side वाली जगह हमारी खाली है, we'll fold it in this way, and the another by covering. A tight blade holder is ready for you, right? And after that, now everyone will take your potato, and then we start with scraping from up to down in same direction. Place it very gently on the skin as we place that Viddha Karma needle, and just scrap it gently. From up to down. But not too much close. The cut should not be too much close and too much far away. If we have to prick this whole area, okay, we'll place the cup first and take the markings of that area. We'll take the blade, touch the blade superficially on the skin, just scrap it. 1, 2, 3, 4. Then next line, 1, 2, 3, 4, 5, 6, 7. Then 1, 2, 3, 4, 5, 6, 7. You have to make only one, single one. 1, 2, 3, 4, 5, 6, 7. The cuts are okay. Now you will apply the cup according to the condition, according to Sukumarta or cutting patient. You will select 2 punch is enough to take the bleeding out. If your cup is old or you are using any old cup, you have to go for 3 punch also and 4 punch also. Maximum is 4 punch. If you are going for 5 punch, that would cause a PO. And if you are using more than 2 punch in a Sukumar Vyakti, that will also cause atiyog and bruising and blisters will form by cupping. So the main thing is that you need to select the patient's skin type also. If it is Sukumar, only 2 punch is necessary. I'll tell you about the punch, how much punch and how to punch it. The cupping gun is there. One full punch and another full punch. Or you can take one full punch and one half punch. Or you can take 2 full punch and then go for 1 half punch. That's it. It depends upon the yukti at that time. When you are doing it on the patient, you need not to go for 5 punch or 6 punch. That will cause atiyog and blisters will form, and even the layers of skin comes out if you have placed it for 10 minutes, 15 minutes. Like most of the patient goes through cupping, and after the cupping their marks never gone down because they have applied the cup for 10 minutes, 15 minutes. No need of applying that for 10 minutes or 15 minutes. Only applying the cup for 2 minutes or 3 minutes can give you same result and better result than applying it for 10 minutes. You can do dynamic cupping on the patient. It will give you good results. More than static cupping, dynamic cupping gives good results. Because you will, no, that's gliding cupping. Moving cupping is gliding cupping. You will apply the cup and then remove it. Apply the cup and then remove it. That is dynamic cupping. Apply and remove. Apply and remove. That won't cause any scars on the patient body also, and that won't cause any side effect. And in 100 out of 1 case, only little bit of complications are there. 1000 of 1 case. Like someone is very Sukumar or skin is very gentle, but that scars heals within 3 or 4 days. Or maximum the time which I have seen is 7 days or 8 days. In diabetic patients, I have done cupping. It took around 1 to 2 months to heal that scar. So in uncontrolled diabetic patients, never go for blood cupping without controlling the diabetes. Blood cupping has to be selected after a treatment of 15 days or 10 days or 7 days. At last you should go for blood cupping. First you will get results with Viddha Karma. You will get results with Abhyam Vegan and all the PDs and Lasti. And then if you want, then you can go for only blood cupping. That depends upon your routine.
Well, we have to do the dry cupping before blood cupping.
Dry cupping is before doing blood cupping is necessary just because it will mark the area for them. If you haven't marked the area, like this is the area. You have to do blood cupping on this area, and no marking is there. You will just scratch it, and after that, when you will apply the cup, what would be there for outer area. So that's why marking is necessary. And even what in the starting while doing Viddha Karma, marking is necessary. Like when we started with Viddha Karma, sir, you should tell that you should have a vernier caliper, or we take a pen, take the Angul Praman of that patient, and according to that Angul Praman, sir marks the area. Then only we do Viddha Karma. So marking is that much necessary. Everyone will do marking here itself. Everyone will take Angul Praman, and then we'll go for Viddha Karma. Not directly doing Viddha Karma on any point. We'll take the Angul Praman of that patient itself, not Angul Praman of Vaidya. So this is the main thing. And after using the blade, how will you discard? Take the blade out, put it on the same way where it was placed, close it, break it. And then according to BMW norms, we'll put it inside. So everyone has practiced. Anyone left? After that, another procedure, what we'll do is, we'll take with the karma needles, now using with the karma needle to remove the so we'll take it in this way, and then we'll try to remove it.
You will stand up.
See.
നമ്മുടെ എൻ്റെ വീട്ടിൽ പോയിട്ട് മൃതം ഇരിക്കുന്ന മുറിയിൽ ഷെൽഫ് ഏരിയസ് ഓടിച്ച ബോഡിയിൽ ഫോഴ്സപ്സ് വെച്ചിട്ടുണ്ട്. അതൊന്ന് എടുത്തുകൊണ്ട് വരാൻ പറ്റുമോ? ഹലോ, വീട്ടിൽ ഞാൻ വിളിച്ചു പറയാം.
For removing the petals, just need to put it in this way.
കൃഷ്ണ എവിടാ? കൃഷ്ണ പിന്നെ എവിടെ? ശ്രീശങ്കരനാണ് വിളിക്കുന്നത്. വിളിക്കാൻ പറയാം. ശ്രീശങ്കർ മോഹൻ അങ്ങോട്ട് വരുമ്പോൾ എന്നെ ഒന്ന് വിളിക്കാൻ പറയും. അമ്മയോട്
You will take the needle and then place the needle in a perpendicular way, apply it and then just apply the needle. Okay. And now, why hard surface is this? Why we are using coconut? We could have used corn also and other things also. This is to feel if you have touched the bone or scalp. You are pricking it on the scalp, but how would you get to know about you are touching the scalp or you are touching any bony part? So for that, coconut was used that you have to be point specific and area specific. I have read it has not touched the scalp bony structure. So now every one of you can practice it. For even you can practice it on coconut. We take a group of 7 leaves in that case. 1, 2, 3, 4, 5, 6, and then 7. Now, selecting 7 leaves and pricking, you can feel the different layers of skin. If you are pricking it on head itself, if you prick more, it will harm the bone structure inside or skull. So what you have to do is, you have to do a prick on the leaves and close your eyes. Close your eyes, then keep the needle. 1, 2, 3, 4, 5, 6, and 7. Needle is up. All the layers you can do. Or you can place for the starting. You can play. Don't join them very clearly. Make a little bit of difference and then start. You can feel all the layers by closing your eyes. At that time, no things were there. How will you take everything? Then placing the needle on the skin, then feeling the difference. Now, if you when you will be working on your clinics and hospitals itself, so when you will be pricking on to the patient, you will feel the difference while pricking. Finger on your scalp. It is not 1 by 4, most probably 1 by 5. Only 2 mm will go inside. Only this one. Or it's better to take that insulin needle, place it on the scalp very gently and then prick it. Place it very gently and then prick it. Even in some cases, sir is using Prachan for total hair loss, and that's how we get a good result. And in some cases, sir uses because Prachan area from the center of your hair to ungul away. What sir used to tell us, different types of nasya you can give in different condition. Like if such condition is there, you can take sheer, mix it with jasti madhu, make little bit of sheer pak, not exact that sheer pak, little bit of pak, that jasti in that dugh, and then give nasya with that dugh. Patient there itself are not allowing us to do proper nasya. So it's very hard to do convince a patient to do nasya. So what we do, tell the patient to, these are the drops, you have to put 4 drops on each nostril. This will directly go to the spine. We have to make concept according to the patient. So we'll explain the patient that you have to take 3 drops or 4 drops depending upon the patient, how is he willing to do that or not. Combining Viddha Karma, Agni Karma with Nasya gives best result as compared to only doing Viddha Karma. So that Shriman and Sudan, I give Pratimash Nasya to the patient to do this daily. When you wake up early in the morning, just do some brush and then lie on the bed, put 2 drops. Pratimash Nasya can be done anytime, but in morning it's good. So I always go for Nasya and then start the treatment. Though Nasya is that much necessary. So everyone has done it on the skin, on leaves. Now along with that, after this I'll explain you about Agni Karma, Dhatusved Agni Karma, which can be done daily, and then we'll directly demonstrate it on any of you who want to volunteer as a patient. Any one of you having back pain, shoulder pain, manda shoot, any one of you can. So, and every one of you has to prick a needle, get it pricked. It's just because unless and until you are not pricking it on your body, you won't feel how it feels. Even I have done yes, मतलब मैंने अपनी सारी बॉडी में सारे प्रोसीजर्स करवा के चेक करा है. Every procedure I have checked it on my body. So that's why until and unless you are not feeling that procedure, you won't know that how it feels on the patient. This is the main thing. Now we'll start with different points, and after in 5 minutes we'll start with our practical. So we have discussed it till Shipravid. Any doubts till now? Or many doubts? So now moving on to Galgand. Urmul Sanshrita Galgande. So where you have to do Viddha Karma on in the case of Galmand, Urmul. In the medial axillary line of the body between 4th intercostal space. And how much you have to break? Only Ardhavrihi. For the starting. You can do Vanvrihi also. Vanvrihi, we used to do Vanvrihi. But for the starting, only go Ardhavrihi. And after the experience, you can go for Vanvrihi also. Then in case of Avbahuk and Trityak and Chaturtak Jwar. In Trityak and Chaturtak Jwar between Triksandhi, and in Chaturtak Jwar Skand Sandhi. And Avbahuk I have already told you on anterior and posterior side of the shoulder, and sir used to do it on lateral side also. Then Apasmar Hanusandhi Madhya, and coming to Unmad, Shank Keshan Sandhi, Apang and Lalat. But we need to find the cause of Unmad also, and we need to treat, and cause of Apasmar also is to be treated. Patient counseling is very necessary in case of psychosomatic disorders. Patient needs counseling, and then you will go for the treatment, because at that time counseling is very necessary. Counseling plays a big role. Then जीवा रोग एंड दंत रोग. जीवा रोग में आप जो करेंगे जीवा के तल पे करेंगे. So starting of जीवा. So on the frenulum, when you see left side and right side of frenulum, done. The vein is there, and in Dant Vyadhi it's done on palate, but even I have not done because it causes damage to trigeminal nerve. That's why detailed anatomy is needed. You need to be perfect in pricking. Only 1/5 Re is to be pricked in that case. Sir also used to do half Re in the case, but in like most of the students are doing it on Dantrog, and 5 out of 10 doctors gave trigeminal neuralgia to the patient. So that's why you need to be very careful while pricking or doing Viddha Karma for Dantrog. Even I have not done it. Then Talu Rog, Taluni, Tal Eshu. तालू के तल पे आपने वेदन करना है. देन गोइंग टू घृद्रसी एंड विश्वाची. जानू संधि से 4 अंगुल ऊपर एंड जानू संधि से 4 अंगुल नीचे. इन केस ऑफ विश्वाची कूर्पर संधि से 4 अंगुल ऊपर और 4 अंगुल नीचे. 4 अंगुल पेशेंट की लेंगे या वैद्य की? पेशेंट की. सो यू नीड टू मेजर 4 अंगुल ऑफ दैट पेशेंट. इन द केस ऑफ घृद्रसी द एंगल और पोजिशन ऑफ पेशेंट शुड बी 90 degrees. So this is an angle of 90 degree. Tell the patient to lie down on the bed and then make an angle of 90 degree. Or another thing, ask the patient to sit on the chair and then you can make an angle of 90 degree. And in the case of Vishwachi, semi-flex, semi-extended position on lateral side. So which vein is there? Vein. We need to puncture cephalic vein. कर्णशूल में जहाँ पे आपका एयर एंड करता है, जो अपर मोस्ट पार्ट ऑफ एयर, जस्ट बिहाइंड दैट दिस एरिया. और एल्स यू विल ड्रा अ स्ट्रेट लाइन फ्रॉम विदुरमर्म टू योर हेयर्स, द जंक्शन वेयर हेयर्स एंड स्किन मीट्स, you can prick it on that area. And for Kanshul also you can do, and in case of Brahma also you can do it on this area. नासा रोग में, नासा आग्रे में, you will every one of you can touch your nose, tip of your nose. So you can feel two ligaments on left and right side, and in between that there is a hollow space. So that hollow space is need to be pricked. I was in Ernakulam yesterday, and sir told me to do with the on everyone's NASA. Dr. Binoy sir was there, and sir, why sir told me to do that? Because everyone is afraid of doing with the Karma at NASA, but it is very easy, very easy. And the patient with Pratishay, you can treat a patient with Pratishay with NASA with, and I combine it with Dhumpan and Jashaman Aushadhi. There was a case of Pratishay. The patient was having Pratishay from past 15 years, and he took visited all the doctors who were specialists in allergy in Dehradun itself or in Uttarakhand, in Rishikesh and other areas. And at the time when he was taking medicines, he was getting results, but little bit. But at the time when he was taking allopathic medicine, he was feeling drowsy. So what we selected at that time, we did Viddha Karma on Nasagre and Upnasika. And along with that, I combined it with Agni Karma for 3 days. The symptom on the very first day, patient started sneezing 15-20 times. After that, it subsided. We did Dhumpan, and I told the patient to do Pratimarsh Nasya, because doing proper Nasya there itself is very hard thing. So for 3 days I did, and I told the patient to come after 10 days. And only the medicine which was given was Sitopladi. But why Sitopladi? At that Sitopladi main ingredient which works is Tugashiri, Panslochan. And the Panslochan which is available in market or any other pharmacy which is providing, these are silicates. It's easily available for 150 rupees per kg, but original Panslochan costs around 7 to 9,000. So how is it possible that a pharmacy is giving Panslochan in 200 rupees? Oh, sorry, Sitopladi Chun box for 200 rupees. Is it possible? So you need to go for pure Panslochan in that case. And Panslochan, which I am getting it from the market, are silicates. But when I had a word with my dealer, his father was an old Vaidya. Now he is only supplying raw drugs to all the different parts of India, wholesaler, to all the factories, most of the factories. So he told me that when you burn a bamboo, after burning a bamboo, you will find white, very light-weighted stone-like structures. So that is original Panslochan. And if you are getting Panslochan, even when I am taking Panslochan from him, more than 50% or 60% are white silicates of bamboo. The other 40% part or 50% part is the rock, the ash of bamboo. So if you are getting Panslochan, white silicates are not the original one. White silicates mixed with grey color ash of bamboo is the original Panslochan, and it is very lightweighted. If you are holding a big white silicate in your hand, you won't feel any weight is there. So that's the pehchan of pure Panslochan. Even we started collecting Panslochan, and the Panslochan is only available and only found in old bamboos. So Panslochan can be used in many diseases, but the thing is you need to find original Panslochan. The protocol which I followed was Viddha Karma for 3 days and continued with Agni Karma, then Dhumpan and Pratimarsh Nasya. Upnasika, I'll tell you. And Nasagre also you can do Agni Karma. After that, we've told the patient to come after 10 days. In 3 days, the symptoms subsided, and after 10 days, we did Viddha Karma for 3 days again. Now it has been around 9 months. The patient didn't have any symptoms of episodes of Pratishay, and this was the same patient who was taking allopathic medicines from past 10 to 15 years. So in the case of Pratishay also you can do, and most of the post-COVID symptoms, it's seen patient don't feel any smell, loss of smell. So in that condition also you can go for Viddha Karma at Nasagre and Upnasika. Then moving on to the next, Netrog and Chirorog. In case of Netro, I'll tell you the points when we'll do it practically, how to look at it. Nasagre is just the tip of the nose. On left and right side, you will feel a ligament, and in between that, there's a hollow space. That is Nasagre. And Upnasika is the bony structure and where the bony structure and cartilage end. Here is the junction of bony structure and cartilage, and from here you will draw a straight line. So you have to do Viddha Karma here itself. And you can do Agni Karma also. In case of sinuses also, sinusitis, it works. Then Netrog and Chirorog. If someone is having heaviness in eyes, we'll do Viddha Karma only on Apang and Bhrumadde. That will give you good results. You will feel, at that time itself, you will feel little lighter. Eyes will feel lighter. Akshi Guruta and different types of Akshirog. That is a part of Shalakya Tantra. So in case of Akshi Guruta and weakness of eyes, you can do with the karma in normal patient. But if someone is from Shalakya and then he wants to go for that, in second part Uttar Tantra, it's written very clearly, and there are different books of Shalakya Tantra in which different areas for doing Siraveda is written. And that area you can do with the karma, right? And in case of Shirorog also, Lalat, Apang and Bhrumadde. Bhrumadde is the center of our eyebrows. The center where our eyebrows meet is Bhrumadde. And Apang is, I guess, it is marked little bit up. That is Puch, and below that there is Apang. It's marked little bit wrong. In the next slide, it's right. So now when it comes to Katishul or Katigrah, we'll select the points 2 angul away from spinous process, right? And we have to give the difference of 2 angul itself from coming up to down in doing with the karma, right? And then Janu Sandhi Shul. Janu Sandhi Shul is not written in our text. It is from the experience of Vaidya R.B. Gupta sir and Vaidya Chandrakumar Deshmukh sir on the medial and lateral side of the knee between the articulating surfaces and on inferior part of हाँ PPT send कर सकते हैं. PPT will be shared. After that, Vatrakta. That is the point of Shipramar, and these are the hands of Vaidya R.B. Gokte sir. So sir used to perfectly tell the points where to do Shipravid. And sir also used to tell us that what are the different places or different positions where you while lying where you can do Shipravid. Like the patient is lying on the bed, then also Shipravidya can be done, or the patient has placed his foot on the floor, then also Shipravidya can be done. Then on Ashmari, patient comes with the stone next day or after 3 days. When we do the Viddha for Ashmari, it is done on Angusht Mool. And if you are having a renal calculi on your left kidney, then you have to prick right kidney, and it is need to be pricked on the lateral side, right? Then Hastavikar. These are the Chinese points which are described by Gokte sir. So sir took reference from Chinese points also, and with his experience and applying the same thing on the patients, that gave good results. Like a patient is having numbness, suptata, or daha in heart, or loss of sensation is there. Doing with that, this place can give good results. And the reference also comes in Arsh Chikitsa for Puna Puna Vedan, and in Tikas also it is written to do Puna Puna Vedan at that place. That will give you result. And then these are the points for Pitta Shirashul. One is Bhrumadde and Apankishan Sandhi. And after that, we'll start for Katishul. These are the slides for practically hands-on training. So we'll describe all the diseases mentioned, and then how to do, where to do in a practical lecture. After lunch. So we'll do the practical session after the lunch. Till then, we'll discuss all these things. We'll discuss Katishul, Grudrusi, Manyashul, Vishwachi, Avbahuk, and Shipravid, then for Vatrakt, then for Nasarog, then for Karnarog, Jivarog, Apasmar, Unmad, tennis elbow, and Pittachirashul, then Ashmari, and then Janusandishul, and then Hastavikar and Suptata and Kampan. So this will start after the lunch. This is this one, and Rajat Chalaka, which is made up of silver. Here are using, nowadays we are using Rajat Chalaka or Swarnavan Chalaka.
Someone of the ratio. What is the ratio?
The name is Swarnavan, it is made up of Pital. That's silver. So the name is Swarnavan Chalaka, color of gold, but it is not gold. Because it's very, even if you are putting even 1 gram of gold in the Shalaka, it's very hard to afford for every Vedda. Because if someone is a student, how can he afford a Swarn Shalaka? I was having a Swarn Shalaka which costed me 8 or 9,000 at that time. But now if we are going for a Swarn Shalaka, it's very hard to buy. Because gold rates are going up and up. So better option is using Rajat Shalaka or Chandi Shalaka. Why this is very good? Its heating point is also very less. It heats very fast as compared to Swarnavan Shalaka. And it cools down also very fast. If you are having only single Rajat Shalaka, then it can also work. Or else if you are having only 2 Rajat Shalaka, that will also work. Now how to do Agni Karma with this in indirect? Or 70% of part will go to this side, and the body part which will touch the body should be very less, because if we are holding this part and then applying and giving pressure, the Shalaka will fold and it will break out very soon. But if we are holding it from this side, it won't bend, it won't get damaged very easily. So the thing is that hold the Shalaka. Now selection of the points. If sir is having pain on this area, right? So I'll hold this sponge holding forceps from the front itself, not from this. If you are holding it from this way, again the Shalaka will bend and it will break off. After a month, the Shalaka will break very easily. So hold it from the front, little bit, around 1 or 2 inches of the difference should be there. Then place the Shalaka on where you have marked the point, press it inwards, give a little bit of pressure, and then heat it from any candle, or you can use Diya. Diya also works better and candle also works better. If you are using that flame lighter, it will heat very fast, but slow heat, slowly if you are using that Diya or candle, the heat is transferred slowly and for a little bit more time, and this will give more results. Heating it with that gas lighter won't give you that much of good results, but slowly heating can give you more result. And heating it with gas lighter gives burns to the patient, but heating it with candle or a diya won't give burn. But if you in some cases what happened when there is loss of sensation or patient can't feel anything, we have applied the Shalaka for 30 seconds, 40 seconds, 50 seconds, and even 2 minutes. After that, when we remove, the area is burnt and patient didn't even feel any sensation. But after Viddha Karma and Agni Karma, in 1 or 2 sittings, patient starts to feel hot there itself. Right? So holding of Shalaka, everyone is clear with?
So how long we have to hold?
Till the Shalaka heats. You have kept it, you started heating it. When the patient will feel hot, patient will tell you, and as soon as the patient tells, remove it. That's it. This thing you can do for even a month continuous. It won't cause any burn to the patient because you are indirectly transferring heat. But if we are doing Agni Karma, that will also cause cosmetic defect. Because giving a cosmetic defect to patient is also a very bad thing, because there, if you are doing like if we have did Agni Karma to a patient and then patient is having cosmetic defect, then also they will defame our name. So better is to do it without any cosmetic defect. Or in other patient like females, you can't go for Agni Karma directly. because of cosmetic defect. So better to use this, right? This is dhatu shala, rajat dhatu, only pure rajat is it. This is also because heating point is very less, it works exactly as gold.
So we use it at that set point of pain.
We can use it. Or we will decide pain points according to the condition. Like in Katti Shul, we did Viddha Karma on 2 angul away from spinous process. Then we can do Agni Karma on 1 angul away. Or any point you can select.
From where we can purchase it?
The Rajat Shalaka you can order it from any gold shop, or else I'll ask sir if sir is having right now. And this one Shalaka is available with Talar sir. Sir is having all different types of Shalaka. And one more Shalaka, sir have made this indirect method, Tamra Shalaka also. So in this will only Swarnavan Shalaka will only cost 200 rupees. That's it. Heat transfers same, but it takes little bit more time because it's more thick than the gold one. And I'll give you number of Thalar sir. You can order a Swarnavan Shalaka and the Tamra Shalaka for indirect method. What's this Dhatu sweat? So there is a long wire of Tamra with the Shalaka holder. So the Shalaka, it is holded like this. So you will heat the Shalaka from this side and heat transfers. No need of this sponge holding force. And when it heats, take it out, put that area on other side, and then again start heating. So this is also a thing which you can use. That also costs for around 200 to 250. That's it. And this Swarnavan Shalaka will also cost you 250 rupees maximum, 200 to 250. And about that Rajat Shalaka, if you are making it from the jewelers, it will it costed me around 700 rupees at that time. Now most probably not more than 2000 rupees, but if it gives more results. Or else you can order 5-6 Swarnavan Shalaka and you can use that. So this is Rajat Van Shalaka. Again, it is a stainless steel wire.
What is that?
Rajat Vand Shalaka. It is only stainless steel wire.
Is there any specific size we have to use?
Specific size is mentioned in sir's book. You can read that book also, or you can give the same Shalaka to us. It is 8 mm. 8 mm is the round. And this is Viddha Shalaka, which can be used for Up till now. Any doubt, any questions?
When we do Asnigarma,
Yes.
we will get immediate results, right? So when we have to do this, we are telling about one month or like that.
You can do that.
Yeah, like
But maximum we also do it for 2 days or 3 days also. I'm giving it as an example that you can go for 1 month also. It won't cause any burn to the patient, right? And you are giving just indirect heat, so it won't cause any burn. It is just heating. The
it is the same as
Any other doubt? So now I'll just demonstrate. What we do is, if you are using this candle, that moon will fall down and it can get on your hands also and on clothes also. So what we do, either we can take a paper or a leaf, put the candle inside like this. Now it won't, your clothes won't get dirty. Now we have holded the shalaka. This is how we'll hold this. With front, not from this side. From here itself. And we'll keep the shalaka in this way. And before taking the heat towards the patient, tell the patient, garam lagega to batana. Sir, garam lagega to batana. So this is a normal method. If you want to increase the pressure of the heat or increase the speed of the heat, you will take it nearby. Now we'll go with next shalaka. See, sir, garam lagega to batana. Then we'll remove it. And after heating, what we'll do, we'll just check the shalaka about it. Sir, you can just check it. Is it hot? Is it hot? And so we'll not use it till it gets cooled down. So then what we'll do, we'll take another shalaka. First check it. Cool. So we'll just place it here, give pressure inwards, and then we heat. Sir, garam lagega to bata. That's it. So we like if we want to select a point for tennis elbow, we can do Agni Karma here itself, because we are doing Agni Karma on Marg, not inside Marg. So this was also told by sir that you can do Agni Karma on Marg, not inside Marg. Marg के ऊपर अग्नि कर्मा कर सकते हो, अंदर नहीं करना. अंदर करोगे तो मर्माघात होगा और that can cause pain also. So in tennis elbow, you want to select the point. You can do it here itself also, depending upon where the patient is feeling pain. Just ask, where are you feeling pain? Then just take the shalaka, press it inside. So after applying it on the skin, press it inside to a proper traction area. So proper it is inside. तो पूरी अंदर लेके जाती है. And then heat. अब गरम लगेगा तो आपने बताना. लगा? अभी कुछ दिक्कत नहीं है. No problem is there. हाँ. So you won't get any problem after this.
This side.
One more shalaka was there. Now I'll give it here. हाँ. This is Swarnavan shalaka. So इस वाली शलाका को आप चाहे इधर फिक्स करो, इट वोंट बेंड, राइट? Place it on the skin, press it deep inside, and then start hitting it. गरम लगेगा तो बताना है. So to increase the flow of heat, we have put it more close. And if you want to decrease the flow of heat, we'll keep it here.
So you should do once in a day.
Clear till now?
Just you hit at the turning point though, just to above the...
We can...
This you hit around
No,
the turning point.
we can do Agni Karma anywhere, but how we select from spinous processes 2 angle Viddha Karma, and on after 1 angle you can do Agni Karma itself. 1 angle from spinous process.
Actually, to know about more clarity, I am asking this.
Yes.
Jano say 4 angle upper and 4 angle niche.
Yes.
One point is there.
Yes.
Any significance in selecting it laterally? Because it can be anterior, posterior, or medial.
Sir, actually, that thing was a question for everyone also. But when selecting the 4 points exactly, when you are doing it, if you are doing it on Janu Sandhi, that is the site of Norma, Janu Marg. So 4 angle away from that is the better thing. and why laterally and why medially is the main question. So lateral prick, giving a prick laterally gave more results than pricking it medially with that experience.
Okay.
So even I have also tried it medially also, but pricking it doing with the karma medially didn't give any results.
Posteriorly, did you try?
Posteriorly, I have not tried. It's just because Januar is at this side, from back side.
Forearm above and forearm below.
Hmm.
Sometimes I think posterior also.
Posterior Agni Karma can be done posteriorly, but doing Viddha Karma posteriorly can give marmaghat to that area, and so that's why. And even if you are doing it, most probably some of them give marmaghat, and sometimes when you are pricking it inside, the needle some or the other how touches the nerve, right? But if you are doing it anteriorly or anteriorly and medially and laterally, it won't give any touch to the vein. That's why. And Agni Karma can be done at that posteriorly also. So posteriorly, little bit of heating can be given, and posteriorly heat can be given, or any other side where the pain is there. And while selecting forangul above and below Vishwachi, the vein crosses itself like
Cephalic vein.
cephalic vein is exactly at posterior side. So that's why we are, the main thing is that we are puncturing cephalic vein, and by extension the cephalic vein is pricked properly.
Whether you did this for Vishwaji Shipra Barobari, are you doing it?
Right. Yes, I am doing it for Shipra. I am considering it every time, because if some or the other how pathology is changing, Shipra will control all the things.
And in Rudrasi Andhra Andhra Volkar Andhra, are you doing it?
No, not that.
Shipra Barobari is doing.
Shiprasad Angul Upar is giving good results.
Then this Janu Forangul above and below.
Ha. But you can go for Janu Forangul below also, because and it is also written if the dosh is on Adhogat, do Siraved from Shipra itself, and if it's Adhogat, take it from hand Shipra. So then Adho that sorry.
Yes.
Right.
Yeah. Clear.
So it will be according to that. If it's Adhogat, do it from foot Shipra. If it's Urdhagat, then go for. You will divide the body into place, and then you can do only if you are doing Siraveda from Shipra itself. It will give results. But most of the people don't agree for Siraveda, like taking around 50 ml of blood or 100 ml of blood. So better thing is to do with the karma. Like if there's a Sukumar Vyakti or a small child is coming with pain, he won't get any, he wouldn't get afraid of that small needle. But if you are using that scalpel set to do Siraveda, he will get afraid. And even can be done in pediatric cases also, and after 80 also, there is no age limit to do with the karma. But it clearly told in Siraveda, there is an age limit. And Sukumar also you have to avoid, in Garbhani also you have to avoid, but it can be done in all the cases. That's why that needle is being selected. The Praman is also selected, that it won't hurt any nerve, it won't hurt any karma point. So this is the main reason of selecting that needle also, and Acharyas also have clarity that it would have hurt that nerve. So that's why they are using a small prick.
Any contraindication for Viddha Karma?
Sir, till now, the patient who are having very delicate skins, like there itself the patient are very bright color, and when we prick on them, so sometimes what is it? The blood comes out, and the patch of that blood remains for around 1 month also. I have seen patients, those who are having, and the contraindication is that if a hemophilic patient is coming, then you need to avoid.
Regarding warfarin, taking warfarin.
Can be given. Because we have given also, and sometimes it takes around I have seen 1 hour also, that blood takes around 1 hour to stop. But because the prick is very small, it won't cause any damage to the patient.
This 24 number needle.
Yes,
Is using for
26 and half is used for all the procedures. And if we want to prick deep inside, 24 by Like pricking in sciatic notch, you will go for that. Sir used to prick on frozen shoulder with 24 number needle, right? And even if you are pricking on Shaktra, you can use 24 number needle to prick that way.
Shiprasida Mula Ubri is the point.
Sir, like locating Shaktra Marma,
Shipra or Shiprasida Core?
Shuprasida Ongul Upar. But better thing, what I tell everyone is to do, and when I started doing Viddha Karma was that I used to puncture the vein. So this is the take-home message. Like if you are doing Viddha Karma in any condition, prick it on the vein or take the proper measurement and only go ardhuri. So that won't damage any nerve, that won't go inside Shipramarma. So this is the main thing, just prick the vein only. If you are not finding up the vein, you can use a tourniquet or you can use someone, tell someone to hold the hand and then you can that will give same results as crop pricking will. Because like Deshmukh sir is pricking, he is having too much years of experience. And Gupta sir pricked, he is having his whole life experience. But we are not having, doing that in one day class is not possible. But you can prick that vein, that won't give any harm to the patient. And even in allopathic cases, cannula is only applied here itself or here. So you can prick this area, there is no harm in pricking and you will get the same results as of pricking Shipra, and the same result what you will get from taking 100 ml or 50 ml of blood, same result you will get in 1 or 2 ml. Yeah. So anyone who would volunteer us,
Frozen shoulder in which points?
anteriorly and posteriorly in articulating surfaces, and sir used to prick it laterally also.
Laterally towards lateral.
Towards lateral, perpendicular. And along with that, always full shape.
For Vishwati. For Vishwati.
Vishwachi Charangul Abhavan below Kurparo. So anyone who would volunteer us for back pain?
Yeah.
Cutting shoe. Back pain. Rutika Shalaka. Is someone having that Mrutika Shalaka which I gave? Yeah. So in case of doing Agni Karma with Mrutika Shalaka, what you need to do is heat it with a lighter or a gas cylinder. We'll heat it. After heating it properly, what we'll do exactly on the surface, you can use a paper also, or you can use you can give it directly. Just keep it here below, here itself, and press it. As soon as patient feels heat, you can remove it and apply Shadda. Right? Either who have not seen, anyone can come. For doing it for Vat Kantak or Pat Kantak, heat the Shalaka red hot, right? And exactly the where the patient tells the pain is. So you will take it on pair, exactly on calcaneus spur. You will place the Shalaka and press it. Or another thing what you can do is take a paper, keep it here, and then press it. Right? Any doubts in this? Heat it, place it exactly on that place, and then press it. As soon as patient feels hot, just remove it. That's it. Or after 1 or 2 seconds, then remove it. Calcaneus spur, Vat Kantak. It's mentioned Vat Kantak, but now we are saying it for calcaneus spur. So anyone who is having back pain?
Sir,
Direct. Direct.
Cutty shoot. शर्ट नहीं ऊपर करना है बस नाप पे So we'll select the point for cut tissue. इधर करें. हाँ. You shall have use needles. So we will not use this. So always only one needle is to be used on one patient, and then you need to discard it, right? While doing Viddha Karma on cut tissue, patient can sit on the chair itself also and can lie down, right? So we will do it by sitting, in a sitting posture. Face them. No, I am coming on that side. Weather should always be in a sitting position. Don't do it while standing because that won't balance your hand. So I'll take one chair. Now taking Angul Praman of that patient. So take Angul Praman of that patient only, right? Pen. So how to take Angul Praman? From here to here. This is 2 angul of that patient, right? Sir, only cut tissue or Brudrisi? See. So someone can please locate spinous process. Who will tell where is the spinous process? Marking, right, and here also. Where the problem is, you will select the point at that, in that condition, right? Done. Now what we'll do is, sir, needle. See, patient on 90 degree, sir, chest out. You just clean the area. Done. With experience, you will get to know about that point, but still we are marking it again. Sir, pen. Right. Now we'll take the needle, hold it exactly at the angle of 90 degree in this way. Take the support of your fingers, place it on the skin and prick it and out. Here again, prick it, touch it on the skin, place it on the skin, prick it halfway and out. So now I'm going it very slowly. Place it, prick it, out. Then again, place it. Now I am going one rihi. And now half rihi again. Place it, prick it, half rihi and out. And you can see little bit of blood, only little bit of blood. We'll wipe it off in this way. As soon as we wipe with the spirit, blood will again start flowing. So हम उसको again दोबारा साफ करेंगे. So wipe. Placing cotton in this way will stop the bleeding. But if you are just wiping, blood will start to flow again and again. Right? Cotton is here. Again wipe it. See, the bleeding is not stopped till yet. Little bit of blood is still there, and here also blood is coming.
If Sudhika Parjara is not done properly, the patient may get back pain. In such condition, we can.
You can do Viddha Karma, but after that you need to follow the precaution or do chikitsa of that also.
Sudhika,
Haan.
proper cheese.
Proper chikitsa of that also has to be done. Proper nutrition. Here, sciatic notch, and depending upon the condition, that what is the cause of that sciatica, right? You can prick on sciatic notch, and you can prick 4 angul above and below. See, still जैसे अभी हमने वाइप करा वहाँ से, even little bit of blood is still there. So what we'll do, we'll again wipe it off. So with the small prick, bleeding is still there. So wiping it off in this way will give you good results. So more and more, little bit of blood is coming, but it will give you results. Now for doing Agni Karma in the same cut tissue. Karma. Now each one of you will do that. From spinous process, you can take it from your estimate, or else you want to go for 1 angul. Again, take the dimension of angul praman and then go then wipe it off by take it 1 angul. Right? We place the shalaka here itself. Right? Sir, गरम लगेगा तो बताना है. So we'll place the shalaka here, place it on the skin and then put a little bit of pressure, but holding it from this side. If you are holding it from this side, balance will also not be there and shalaka will also bend. So hold it from this side and start hitting it. सर गरम लग रहा है? बोलना है?
नहीं.
गरम लग रहा है? फिर हटा देंगे. जैसे ही गरम लगेगा हटा देंगे. Done. Now we will come. Just come one by one, everyone. Like I am having diya at the clinic, so in clinic I am not using candle. So what I do after heating the shalaka, I put the bearing of the shalaka in little bit of oil, so it cools down also and also provide snigdagni karma. Right? So not holding it from here, hold it from this side, very close to this. Place it here with the support of your hand, straight perpendicular. And ask the patient कि गरम लगेगा तो बताना है. Done. Next. Take a chair also.
Can we do this after the Dharma also?
Sir, we are doing it after Viddha Karma. Now, take anyone who is doing can take a chair perpendicularly and give. हाँ, जैसे बोलेंगे तो एकदम से बैक लेना है. अगेन हाँ. नेक्स्ट, शलाका पेशेंट को टच करने से पहले अपने हाथ पे लगा के देखने की ठंडी हो गई या नहीं हुई. अगर शलाका गर्म रहेगी so it will heat and cause burns to the patient. Hold it from this side. You can hold it from this side also, but the position should be exact and the pressure should be good. Perpendicular. हटाना है जैसे पेशेंट बोलेगा यू हैव टू टेक इट आउट
അല്ല ഓരോരുത്തരാണല്ലോ ചെയ്യണം അപ്പൊ അറിവ് വെറുതെ അല്ല
वो अगर अगर ये सेम पॉइंट में करता है
विद वाले सेम पॉइंट पे
वो अभी
अग्निकर्मा ऑन सेम पॉइंट ऑफ विद कर्मा इट्स नॉट रिक्वायर्ड you can do it near the spine point specific you can select the points according to you or just palpate the area, palpate the spine. If patient is feeling pain or tenderness there itself, you can do Agnikarma.
Viddha is 8 point now.
Viddha is 4 points. You selected 4 points, 6 points according to you.
Okay.
Depending upon the area. If the patient is having pain here, you will select that point. But I am telling you the points. है ना? After that we'll do. Sir, can you please ऊपर जाएगा ये? ऊपर हो जाएगा? थोड़ा सा please lie down. For doing Viddha Karma, if the patient is in lying position, you have to make an angle of 90 degree, right? And then measure 4 angul, and then you have to do Viddha Karma here itself, right? From Janu Sandhi 4 angul, right? And on Shipra Pradesh 2 angul above Shipra Pradesh, right? And this is 4 angul, Janu Sandhi, laterally. If you are going to study anatomy of the person or the veins are visible, you will find the vein here itself, right? So this is the point. And same thing what we'll do, we'll take the measurement from here also, right? So we'll do with the karma here, with here also and here also. In case of Siraved, what is need to be done? If the radicular pain is till knee, अगर घुटने तक ही pain आ रहा है, तो we'll select this Sira. Then, if the pain is radiating below knee, we can select this Sira also. Or 4 angul above Gulsandhi also we can select. Or other option is if it's getting towards the foot or till fingers, we'll go for Shipra Vidya, right? Veda, you can do Siraved in this condition also, है ना? So now we'll select different how to do Siraved of Shipra also. I'll let you know about how to do Siraved of Shipra also, and with the needle also, with the Karma needle also, right? Siraved we'll do on a person who is having prominent veins. For that, so that everyone can understand how to do Siravedan from Shipra or from Kurpar Sandhi or from hand or from jugular vein. We'll select someone who is having a prominent vein, prominent jugular vein. We can do Siraveda from that side also. We can do Siraveda from here also and from Hasta Shipra also, right? Now again taking the angul praman of the patient. Two angul. This is the best because this area has the maximum surface area of the angul. Here fat is there, here fat deposits are also there, but this is a joint, right? So if you are taking angul praman from this side, you will be getting the proper praman of that, right? Hold it. Now from here we'll move it. Sir, your hand please. You can exactly see the vein, right? So what we'll do, we'll directly puncture the vein. Or here if we are pricking Ardhavrihi also, it will directly go inside the vein, right? है ना? So what is to be done? Only puncture Ardhavrihi, so you will directly get inside the vein, and then you can do Vedan of that karma, right? So for the starting, what you have to do is just try to find a vein and then puncture that. And if you are not getting that vein at that area, you can do Sira Vedan at the nearby Sira, right? Some says that if you are puncturing the needle, it will damage ship, right? So if we are taking it only, it is coming to this place, to Angul Praman, right? And we are pricking it half Ardhavrihi. So Ardhavrihi is only this. So this Praman is more than 3 Anguls. So we can directly puncture this vein, right? Any questions or any doubts till now? Right? We will be pricking this vein. Needle. We are having shortage of needles because the needles were used in Yogya Vidhi. So we will try to complete it with very less needles, and this needle is also 24 by half. So I'm for just telling you how to prick, I'm using this needle. Here you have to use only 26 by half needle. Spirit. More topics are also there. So we'll use both out. We'll just clean it. And if you want to be more clear, I'll tell the same thing on the next photo itself, right? Hold the needle properly and prick. Sir, please come this side. Take the support of your fingers, place it on the vein, and you can just prick it. See, this is a perfect width. Why? Because the blood is coming, and you can keep the cotton here itself, and the blood will start flowing, right? And around 1 ml, 2 ml, 3 ml, 5 ml, 10 ml blood is coming, there is no harm. You can just change the cotton. It can be kept for 1 minute also, 2 minutes also, 3 minutes also. शास्त्रों में लिखा है कि जब तक खून रुकता नहीं है तब तक उसको बहने दिया जा सकता है, बट उसके बाद प्रमाण भी दे रखा है. ऐसा नहीं है कि you will take half liter of blood, right? So that's why praman of blood is also given. That in how much praman you have to take the blood. Sir, fold this leg also. See, the vein is also visible here. Now again, who will take the Angul Praman of the patient? This. Now when you will keep it from this place and rotate it, it comes exactly on the vein, right? Right? Remove your hand. So vein is here itself, you can palpate it also, and here itself, right? So 2 veins are there. Now you are doing Viddha Karma for the very first time, right? You are afraid of pricking it, the vein is not visible. What you will do is, one gloves please. You will tie a tourniquet here. the vein will pop out. Vein would be more visible.
So that needle is half Rihi or
Half Rihi. I have pricked half Rihi only. If I would have pricked around 1/4 Rihi, blood would not have come. So half Rihi is the ideal to prick. If you are not understanding anything, the basic concept is on head area you have to go over 1/4 Rihi, and on the other places you can go till half Rihi. So we'll take this needle, clean the area. Now here you are having problem to you are afraid to prick it on 90 degree angles. So we'll directly prick the vein. Now we are doing Sira Veda, not Viddha Karma. Now those who didn't saw, they can come in the front and others can go. Now we are going for Sira Veda. We'll take the needle. See, the point is here. Hold the vein from this side, palpate the vein, just take it near to that. See, bleeding is there. Now this is Sira Veda. We have pricked the vein. That is Viddha. Both are Viddha actually, and both are Sira Veda. You sometimes if you remove this, the bleeding stops. So you can use this as a pressure, right? So now how to remove? Take the needle out. See, bleeding is still coming. And in some cases when pain is more or inflammation is more or blood flow is more, there is a slight swelling on that point. So it would resolve in half an hour, but the thing is that more and more blood wants to come out. That's a work of mind you have pricked. So see, blood flow has increased because blood was flowing. So now what you will do, you will place your finger and do it like this. Is it gone? Now we will discard this needle.
after this we have to bandage.
No need of bandaging. No blood is flowing outside.
Any paschat
No, we can take any polythene to do.
No, Purva Karma is Sedana.
So we are doing just with the small, very small needle. Like in modern hospitals, they are also giving IV or IM injection. No Purva Karma is needed. By the with the name.
We usually
So yes, we do Purva Karma in case of Sira Veda. We do Abhyanga also and Sveta also, and we tell the patient to have food before that or to have a little bit of sweets. If the patient is diabetic, we tell the patient to take your lunch and then come for Sira Veda. If the patient is not diabetic, we tell the patient to have some sweets or have some pastry or all the things, then come to the OPD. And after that also, we give Madhur and Amlaras to that. Amla and Amla ki chun with some glucose can be given after Sira Veda. So this is a Sira Veda with a very small needle, if the needle is not there with you. And we are still having that scalpel set with us. You can use that scalpel set also to do Sira Veda. Ideal size is 20. With 20 gauge, you won't get any problem, right? It's because the needle is not too thick also and not too small also. That's the ideal size, 20 number. But if you are using 16 number or 18 number, that has a very big size. So that pain of the puncture would remain for 6 to 7 days. Like if you are donating blood, the pain of needle remains with us. Same is the case of doing Sira Veda. So it's better to use 20 number scalpel set, or you can use Kerala depending upon the availability. You have to do Vedan. You can do Vedan with any needle.
tourniquet, how we have to remove?
After this, before removing the needle, you will just slightly remove the tourniquet. Ma'am, cotton please. See, the needle was very small, so blood is not oozing out too much. We'll just clean it.
So after Viddha Karma, how much cost we can pay?
Sir, I am even sir is not taking any cost for Viddha Karma. Sir takes money for doing shaman chikitsa and other things, and his OPD fees. Even I follow sir, that's why I am not taking any charges for Viddha Karma. But like my friends and juniors and some seniors are doing from 500, 200, 100 and 1000, some are charging 10,000 also for doing Viddha Karma. Because it gives result, you can take 10,000 also.
One sitting itself, right?
One sitting you can get results, but we do it for 3 days or 4 days depending upon the condition. Because after that we follow a Panchkarma procedure. So
Okay, so if you do the Viddha Karma the next day, is it okay with that?
next day it's okay
The
to
same
do it.
process.
Same. But you can charge as much as you want depending upon the type of the clinic. If you are having a 5-star clinic, you will charging 5,000 for Viddha Karma. Every patient will give. Like
Actually, after external Svera Karma, we can do Viddha.
yes. Like I'll be demonstrating cupping. After that I do Viddha Karma. Like first for 3 days I do only Viddha Karma and Agni Karma. And after that I go for cupping. Directly I don't go for cupping. At that time I was having only a small clinic. So I tell the patient to do Ruksh Balukas with at your home. So they come and for 3 days they come, do that and come to my clinic. In 3 days only they, sir, we are getting good results. So we are telling them to do Ruksh Balukas because the condition of arm is also there. We do little bit of Sadhya Shodhan with Virichan. Erectile can be used or any other depending upon the Yukti of Vedha. Little bit of Shodhan, little bit of Virichan can be given. Because why I am using Sadhya Virichan there itself, I am not going for a proper Virichan because the patient is not agreeing. Patient won't like when I was there at NRIP, my only question was that sir, how to convince a patient to drink 200 or 300 ml of snake. Even patient, it's very hard to tell the patient to take 1 ml of grit. So what I tell the patient to take 2 spoons of ghee with every meal. Or we have modified it according to the patient. Kathanya Sapta has reduced little bit. Does anyone know? Anterior superior iliac spine and posterior superior iliac spine, and then we try to make a triangle with that. So at that area the sciatic notch is there, right?
So can you demonstrate?
Huh. Anyone can lie down. Literally. Superior iliac spine. And where is posterior superior iliac spine? So we'll just take the fingers like this and just draw a triangle here to here. So here we will prick towards the umbilicus, but half free or 1 free is enough. If you are going deep inside, that will prick sciatic nerve, and that may cause any complications in that case, right? 1 Vrihi can also be done. 1 Vrihi won't prick sciatic nerve, but in crutch patient it can. So in depending upon the yukti, select that point. like this, and just you have to make a triangle. That's it.
So if there is more fat, especially in the more fat defect of patients, is the same the measurement same?
Measurements is same. You have to hold anterior superior posterior.
The king is the same. Same rig.
Of literacy also. Everyone is clear with the points. Now Manyashul. So the cause of Manyashul is also very necessary. That I have told that how to check Vyati is Paritantra or Sarva. Right. So now who will do the marking of Manyashul? Anyone who can come and do the marking of Manyashul? And who will volunteer? So in the case of Manyashul, again 2 angul away from spinous process, and from Ansa Sandhi you can also take the measurement of 2 angul, and then you can break the area, right? And then you will go for Shipravidya. So you will take the 2 angul gap from spinous process, and away from Ansmar 2 angul gap you will break it on the trapezius muscle, right? And then on Shipra. And if it is associated with Vishwachi, then you have to go for the points of Vishwachi, right? Same semi-flex, semi-extended position on lateral side. 4 angul above and 4 angul below 4%. Then we will go for Avbahu. Same, you have to identify the cause, what is the nidan of that Avbahu, and then we are to prick on anterior and superior, and you can prick on lateral border also towards the shoulder, right? And for the patient of Pramehe, this is the main important point. In the case of Pramehe, Kled Utpatti is more. So in that case, what you will do, you will do Agni Karma first, and then you will go for Viddha Karma. Agni Karma in Avbahu, it is told with substance, or with what you have to do Agni Karma in Avbahu. Good. With good you have to do Agni Karma on Avbahu.
How will do, sir? The Buddha.
Same, as we heated the shalaka, we'll heat good, and then we'll just place it on the shoulder joint, right? So, and we'll keep it for around 30 seconds, and then we'll remove it. And the video of doing Agni Karma with good is available on YouTube, on Viddha Gokte Memorial Foundation itself. The page is there, you can watch that video. You can select, but it is told to do an anterior part also and posterior part also. But sir used to break it on lateral side also. It's just because sir, he was getting result, and with some experience sir found to be that, right? Here maximum is 1 Vrigi. You can go for 2 Vrigi also, but it's better to go only 1 Vrigi. Now Shipravidya. So vascular supply of Shipra is also written, anatomy is also written, right? And how can we do Shipravidya? Everyone learned. And what are the diseases we can use? Pada, burning sensation in foot. It can be due to different disease. So if it's Sarvatantra, you will treat that, and if it's Paritantra, you will go to treat other things. Then Padharsh. What is Padharsh? Tingling sensation. और इन केस ऑफ पिपली का संचारण, लाइक पेशेंट से कि ऐसा लगता है कि भाई चींटियां चल रही है पैरों में, यू कैन गो फॉर शिप्रविद ऑल्सो. देन चिप विसर्ग. Anyone who can find the condition, tell me the condition of what happens in visarg. So in herpes also you can go for shipravid. herpes में भी उससे correlate करा गया है, so you can go for shipravid in case of herpes also. Then वातशोणित. वातरक्त के सारी condition में you will select पाद shift और हस्त shift depending upon the condition, right? Then वातरक्त में same, selecting the points of shipra and then you will do. Then nasa roग, नासाग्रे and उपनासिका, right? So lateral nasal artery is also there and vein is also there. You will prick that. So anyone having loss of smell, someone told you. This thing can be used in pratishay also, but depending upon what type of pratishay is this, you will do the treatment. Not in all the cases you will follow the same protocol. Like I was using Sitopladi. Don't use Sitopladi in all the conditions of pratishay. Select the condition and then go for it. So every one of you can touch your nose and try to find out where you have to do with it. And Upnasika, how to find out? So in case of Upnasika, where the cartilage and bone meets, exactly at this place. Same you can do this in the case of sinusitis also, right? And on the tip of the nose, here itself. For doing Viddha Karma on Nasagre, I'll tell you 2 points. In some cases, the vein is little bit up and down, so you can prick 2 points here itself also. But it's better to prick only tip of the nose. So in this case, some cases the patient nose is not clearly defined, the tip is not clearly defined. So vascular structure can be different according to the patient, right? And now in case of this loss of smell, we'll first do Agni Karma with Dhatu Sved and then we'll go for Viddha. Or if you are not having Agni Karma Chalaka, you can directly go for Viddha Karma. No compulsion is there, right? Shalaka. So DN septum is tilted, so we can't do this with pricking. This pricking is only it's better to use sharp. Balapati works best on Apaman sharp, and after that you can clean it with Nimbu Suru. That also works as sharp.
So Nasasha.
Same. Using Balatak tail on that arch, or you can go for Apaman sharp. Apply that sharp. Tell the patient to count till 100. Remove it with Nimbu Swaras. Apply the Shalaka here. Sir, garam लगेगा तो बताना. गरम लग रहा है? हटा दो. Another Shalaka. You can do it here also in some conditions. So in this condition you will do it here. Done. Now we'll go for Viddha Karma.
Smell it,
Cotton. Cotton thread. Spirit is there. Little was. So some more cotton. Ah. Clean the tip of the nose, right? Clean Upnasika. Tip should be pointing towards the patient, right? Hold it. You can feel a slight groove inside. No? Place it on the nose. Done. We did it here, but sir knows the point is not proper, so we can do with the hair also. Place it in this place, and then Upnasika, hair and hair, half free only. Is it? See.
If the patient is having postprandial
I can stop.
timing, you can stop
We can stop.
2-3 days.
We can stop it on the same day, same time also. See, I was using normal cotton. The blood stopped. Now when I'm using this, smell आ रहा है. You can feel the smell. Orange.
പണം കിട്ടിയോ? എത്ര കാലമായിട്ടുള്ളതാ?
ഒട്ടുമില്ല ഡോക്ടറെ, കോവിഡൊന്നും വന്നിട്ടില്ല. അതിക്കുമ്പോഴുണ്ട് ശരിക്കും ഫീൽ ചെയ്യുന്നുണ്ടോ? ചില സ്മെല്ലൊക്കെ ചെയ്യുന്നുണ്ട് ഇപ്പോഴും.
You can get results in this much of time also.
ഇവരോട് നല്ല പേരുണ്ടല്ലോ എക്സ്പീരിയൻസ്.
This is Rasagre, Nasika, cartilage, the bone is here from here to here. Nasagre, cartilage, bone, removing spikes. Nasagre, cartilage, bone, from here draw a triangle to the skin, then mark it, and you have to do Viddha Karma hair itself, right? And in the other cases, what you will do, this is with Durmaram, and you will draw a straight line till hairs. So the point where hairs and skin is meeting, you can do Viddha Karma here itself also. It can be used in the case of Brahm, and here you have to go only 1/4/3 or 1/3, not more than that, right?
Vertigo?
Can be given, but you need to find the cause and then you will do for any other.
Sir,
This side, okay. See, the uppermost part of the ear, here, like, and where is Vidurmar? Just beneath the ear. So we'll draw a straight line from Vidurmar to hairs, है ना? And at the junction where hair and our skin meets, so you will do with the hairs. Half. No, not half vree, 1/3 vree or 1/4 vree. Don't go 1 vree or half vree inside that area. That will surely damage the nerve. Sir, found out some sir only but sometimes complication of the injection also better to avoid it. Manyashul, I told the points.
The needle should be kept over there, or we should actually remove it?
We should remove that. The same thing which we did on Katishul, same has to be done on Manyashul. Or any one of you can come, and someone who has understand the points, he will mark the points. Anyone?
Manyashula.
For Manyashul. So next or first Manyashul?
Manyashula.
Anyone can come. Anyone who will come here as a volunteer for Manyashul. We won't prick you. Come. Turn back. Udar. Any you can come. Take Vrihi Praman. 2 Angul Vrihi Praman. Done. And check spinous process. Here it is. At the center of the spine. So from here to here. Right? So you will mark 1, 2 or 3. Done. And if the patient is having Shirashul accompanied with due to Manyashul, cervical induced headache, then you will go for points which are present here. And if the patient is having radicular pain, then you will select the spine according to that. And after that, if there is thumb on the trapezius muscle, like she is having, ma'am is having stiffness also there, and subthigh is also there. So in this case, 2 angul away from unsmerm, or if by mistake you prick unsmerm, so at this point, place where unsmerm is there, always try to prick only half free. Do not go beyond half free. So after half free, our nerves are there. But if you are doing it on a very thin person or very crutch patient, then go for 1/4 free only. So it won't touch the nerve, and it won't destroy, and it won't give aghat to that merm point also and the nerve also, right? And after that you will select shifting. Then Jivaro. Anyone having for trapezius, like you have measured this as 2 angul. So what you will do from you can do with the hair also, and you will start marking the points here, and again 2 angul from here. Here also, here 2 points. 2 points. Do not do tuck 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 on every place. Because I have seen many like someone is there from Dehradun itself. So what he is using a needle, and wherever is जहाँ पे उसका मन करता है वो टक 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 हर जगह मार. That is not Viddha Karma. So Vishwachi we have discussed, above we have discussed Shipravid, we have discussed Vatrak, we have discussed Nasaro, Karnaro, Jivaro. So who will come for Jivaro? Anyone having loss of taste? Taste is not there. Anyone loss of taste? No. So जीवा मूल पे आपने विद्ध करना है और कहाँ पे करना है? फ्रेनुलम के लेफ्ट और राइट साइड पे. और कहाँ पे कर सकते हैं हम जीवा स्तंभ एंड द पेशेंट दोज हु हैव min स्वभाव sluggishness in voice and then you can go for that. Then mukpak also can be given. Galgran मतलब if someone is having problem in chewing and putting it inside, then also you can go for that. And अधोदन नीचे के अगर जो दांत है हमारे उसमें शूल हो रहा है, then you can go for with the at this place. One good thing is there, if you are pricking on that area, that won't hurt any nerve. So that's why adhodant shul in adhodant Viddha can be given at that point itself, right? And deep lingual vein is there where you have to prick, right? And in some cases there is a reference from Chinese medicine also. So where you have to prick according to Chinese medicine, it's only 1/4 free on anyone, sir, anyone who is having whose Adam's apple is clearly visible. So on superior left lateral and right lateral border of Adam's apple. So these are Chinese points. Now moving on to the next, apasmar, only Hanusandhi Madhya. Someone is having stress, tension, anxiety, depression, that all comes under apasmar. So you can go for apasmar with. How will you check where is Hanusandhi Madhya? Open your mouth. Place a finger where your जहाँ से आपकी दाढ़ी जो है और बाल जो हैं जहाँ पे आपके खत्म हो रहे हैं, तो प्लीज ओपन योर माउथ. So this is Hanusandhi Madhya. Keshan Sandhi. Here the hairs are getting end. So after that Keshan Sandhi you will find TMJ or center point of the TMJ. And from here you can draw a straight line here itself, and in the between you will find See. Anyone having stress, tension? Apasmar. So we'll do.
Insomnia we can do.
Insomnia they are coming. For the point of Unman, you should go for the point of Unman. And apasmar points is also considered in the case of insomnia. But the points of Unman and apasmar combined together, then it gives it. And along with Hanusandhi Madhya, you should go for Brahma. चलेगा. Anyone for apasmar? You can sit there. So in Pitta Shirashul, Blumadhe and Bhupan, the area where Shankamaram is there, or the V shape of our hairs, where it ends, you can do with the karma there also, right? So now there is, she is having Shirashul also, so we will do point for Shirashul and apasmar itself. And if any female patient comes little bit stressed up, so I always do point for apasmar. I always do with that Hanusandhi Madhya. Now open your mouth. There is a center point. Close. Ishan Sandhi is exactly in this place, right?
ഇപ്പുറത്ത് ചെയ്യാമെന്ന് പറഞ്ഞു, ഇപ്പുറത്തെ സൈഡ് കാണാം.
Can you please remove? Hold the needle properly, and Hanusandhi Madhya you can go till halfway. Bleeding is coming, you just wipe it off. Anyone can take the cotton and please wipe continuously. Then Keshan Sandhi, here itself. So see, blood has not blood didn't came out. One by four. See. Keep it here. Done. Or else what you can do, you can prick it here itself. See, you can feel a vein here. So if someone is coming with severe headache, just palpate the vein, place the needle over it. After that, Anusandhi Madhya, half free. After that, Ru Madhya, little bit of blood came out.
Headache of any origin?
Or tell the patient to open his or her mouth. See, close. Here is it. You're still having? Little bit reduced or same? Because blood didn't ooze out. See, again vein is here. You can go for with the hair itself. Little bit of blood is coming. But here we punctured only the vein. Reduce. So after that we can go. We did only one, pain is reduced, but you can go for 2 or 3 slight, but it's reduced. Apaswar, Shaman is also very important. Pan is very important. Shaman Snepan is also very important. Along with that, if you go for
Yearly Shogun.
Shogun is very necessary and Nasa is very necessary. Along with that, you can go for continuous 3 to 4 with, and after that, once in a week or once in a month, you can go for that. Easily well paid away beneath that. Now moving Ishan Sandhi, Apang and Bhumat. We have discussed the same. And after Unmad, tennis elbow, we have already discussed same the points of Vishwachi, and Agni Karma along with this also works very better. Or in Agni Karma, Chinese have also developed a new technique which is hot needle therapy. They put that acupuncture needle inside that place, and this give a little bit of heat to the patient. So that also gives very good result. Except Agni Karma and Viddha Karma, this is the only thing which I am using it in my clinic. Outside Agni Karma and except Ayurveda. So this is the main thing. in which the reference is not yet, I can't find the reference of this in Ayurveda, but I am using this procedure not exactly on Kurpar Sandhi but away from Kurpar Sandhi. That gives very good result. You will just insert the acupuncture needle, 25 by 0.25 is the size, and after puncturing it, you will just heat it with the gas lighter. As soon as the needle is red hot, remove the lighter and start giving the heat on the other place. So you can give the heat 2 times or 3 times. It causes a small injury on that area, and that starts to heal. And basically this was being discussed by an Chinese doctor. So he tells that the nerve sensation of that area is being disturbed by giving that hot needle therapy. So that's why pain is reduced. But after that we need to, he also gave the same explanation for that. He told that if the patient is having tennis elbow due to shoulder pain or cervical pain, he should treat that first. The pain will be reduced with that hot needle therapy, but it's better to treat the cause of that. Now after that, Pitta Shirashul we have already discussed, and ma'am have got relief in her pain. Same, Bhru Madhya and Kopal. Then Ashmari, Angusht on the opposite side. Like if you are having Ashmari on left side, you will do Angusht Mool with on right side. So anyone who can come, I'll just explain it, but we are not going to break it. Anyone who is wearing slippers can come here. How to locate Angusht Mool? Done on lateral aspect of that Angusht, right? So how will we do? This is the very front line. If we are folding, अगर हम अंगूठे को ऐसे मोड़ रहे हैं, तो if we can find this line only, right? So we will draw a straight line from this area, right? And from where the nail is meeting the skin, we will also draw a straight line, right? So we'll do on the center of from here to here. इसके center में हमने विद्या करना है यहाँ पे. So then we'll get results, है ना? So Angusht Mool is this point. If you are doing with that this point, won't give any result, cause Gupta sir find this with the in our Sahitas, and then also confirmed it in other books also. So in Mutra Vikar also you can do this.
On left side of kidney.
If you are having a stone on left side, you will do on right side. If you are having a stone on right side, you will do it on opposite side. Opposite side has to be done.
This is for pain only or?
For Ashmari it's written, but at Sir clinics, patient comes with stones from next day or after 3 days. Sir has attended Sir seminar and patient comes with the stone. Even I did Viddha Karma on 4 to 5, I have a data of only 4 to 5 patients. Very small particles of stone came, but the pain of that pain was relieved within minutes. We did Viddha Karma at that time. The patient was having pain, and there's a patient. His chacha uncle is even my teacher. So he was having pain, and luckily I was only having one needle with me. We were in Mussoorie, so we went for a trip. So he was having pain, and he told कि भैया बहुत ज़्यादा pain हो रहा है, what to do? So I just did with at this area, and the pain was relieved in a minute. We got relief in a minute, and after that he still doesn't have any pain from that day, and it is around 2 years from now, more than 2 years that he didn't got any pain. So
Here also you should take out.
you can break and let the needle stay for 10 seconds or 5 seconds, but ardhvrihi, because if you are going more than ardhvrihi, it will touch the bone structure, right? Even I pricked on Angusht Mool also. I got good results. I got it on
Only one side or both sides?
but I can't speak this thing because the thing is that that's not written in the Vadrapita case में शिप्र नहीं करता. Finding the hero of that disease, what Shamanaushadhi sir is giving. No one focuses on that. Sir always write all it in detail. Articulating surfaces. Sir told us this point because it is not written in our text. It was with experience of sir, right? So in this condition, lateral side and medial side between the articulating surfaces, right, and along the lateral and medial side of the patella, right, and along with Agni Karma and Sandhi Siddhant Chikitsa, it gives good results. We are using different because in Sandhi Siddhant Chikitsa, not only adjustment of Sandhi is written, it is also written different types of traction techniques and different types of manipulation techniques that can be used. Right, so along with Agni Karma, Sandhi Siddhant Chikitsa and different Kriya Karmas give good result. Now Hastavikar and Suktata. See, so these are Chinese points and the reference come with the Puna Veda and it is given in Arsh also. So these are the points where you have to prick and anyone who wants to know can lie down, will tell the one. Or it's better to do 1/4 breath. If you are anyone has used anesthesia on hand? No. So what in modern medicine or allopathic doctors does, if the hand is cut from this area, they never give anesthesia from this side because nerve endings are there itself. So what they consider to give anesthesia on this place and this place. So this will block the whole finger and then no sensation would be there. So the same thing Chinese medicine are also using and sir also found that to prick on the knuckles of the hand. There was a patient who was having he was continuously doing like this. He was having symptoms of Vishwachi, but Vishwachi was easily treated. All radicular pain was easily treated, but he was having still this type of sensation. He always used to do like this, and it was a mixed sensation of tingling also, daha also, and suktata also. So we did for around 7 to 10 sittings, and after 7 to 10 sittings, now he is pain free. But on the very first day, I didn't did Viddha Karma. I just followed the path of Vishwachi and just followed the concept. When that pain or tingling sensation didn't go after doing the points of Vishwachi and Manyagraha, then I did for 7 days or 10 days. Now it's being 3 to 4 months. He is not having any tingling sensation or any suktata. Same, you can do it on the foot itself if a patient is having suktata or nothing. Now you will go at the angle of 90 degrees. Now you will not go like this on 180 degrees. Now you will go like this. Just place the foot here. Position of Angush and index finger. Thumb and index finger, the center point of thumb and index finger is not to be selected. After that you can go for that. Legs also the same. You can see the vein here. You can see the vein here. And you can see the vein here. And if this is not applicable, if you don't want to do, make the hand like this. आधा से करो. This place, this place, this place. So there is difference of around 3 to 4 mm in this area, right? So it's better to do like this because the position of veins are good in this condition, right? 1/4 1/4, right? 90 डिग्री में जाएगा. फुट आपने जमीन पे रख दिया एंड इन आफ्टर प्लेसिंग द फुट इन 90 डिग्री parallel to the surface of the floor, and then your needle will go 90 degree.
1/4 breath.
1/4 breath or 1/3 breath can also be done, but not beyond 1/3 breath. Medial side, lateral side, and here. 1/3 breath is considered best, or you can go for 1.5 breath also. Here you can go 1 by half Vrihi, or 1 Vrihi can also be given, but depending upon your experience and the applied anatomy, right? And then go for Agni Karma, indirect Agni Karma on this area. This area it can also.
I'm having knee pain.
Should we go for that, or should we wait till cupping for cupping, right? So this area we can also give. We can do Agni Karma here also. We can do Agni Karma here also. We can do here also. Here either ek do points we can select. Either also we can select take the points, and
select point with 10 points.
you can do when where the patient is having pain. Pricking?
Whether popliteal cyst is there?
No.
No issue.
Need not to prick on posterior side. Posterior side is not needed to be pricked, right?
For 100 you read,
1.5 Vrihi, no?
you told 100 free we can be applied here.
1 by 2 Vrihi.
1 by 2. Oh,
हाँ.
half.
1 Vrihi you can go.
Okay. Or half.
1 Vrihi can be done. But
And this one from Gulfa 4 angle above there is a point for a posterior shisha.
yes,
You are doing it for knee pain? No.
yes. I do it for sometimes, and sometimes I am not doing it.
Okay. What is the selection criteria? Why
Uh,
doing in some cases?
Sir, actually, I got better results in doing it exactly on the knee and
Knee
with
itself.
shoulder.
Okay.
So that's why I'm not selecting that point. We can do, like I have done on some of the patients I have done, and I have did Siraved also at that point.
Okay.
And Agni Karma above Gulf. So we got results in that also in Grudrusi. I have tried it on the patient 2 angle above Gulf, so it gave good results. No one is have daring to get his or her jugular vein pricked. But if you are doing Siraved and jugular vein, then you can win all the Urdu Jatrugat Vikar associated with Pitta also and Rakta also. So it is that much necessary. If you can do jugular vein Siraved, it is very easily, you can easily win. If it's visible, we'll do. It's as easy as putting a center line. See, ask the patient to lie in this position. है ना? So the vein is easily visible, right? So now I'll tell a different and easiest technique that patient won't any fail if the कभी कभी क्या होता है कि निडल जो होती है, निडल मूव्स आउट ऑफ दैट वेन, बिकॉज ये वाली जो वेन है सबसे ज़्यादा चंचल वेन इसे कहा जाता है. जब भी आप इस पर प्रिक करोगे ना, कभी ये इधर भाग जाएगी, कभी ये उधर भाग जाएगी. सो हाउ टू एडजस्ट दैट कैनुला इनसाइड दैट वेन इज द toughest part, but how to adjust it very easily, that I'll tell you. ठीक है मैम, ऐसे हाथ क्रॉस कर लीजिए अपने. No, only say continuous see, when she is saying the vein is coming out. So this is the main point. When the patient says you have to prick it. एक बारी खांसी करना, दोबारा करना, दोबारा से करो, सी करो, दोबारा खांसी, अच्छे से करो. So all of you can see. इसको क्लोज खुला हुआ.
बोलिए.
तेज से जैसे मम्मी बच्चों पे चिल्लाती है ना. Using 20 number scalp pin set is the best. 20 number is the best and easiest thing. And scalp pin set of BD company is the best. or you can use even needle of BD company also. needle. सर आप इसको ऐसे पकड़ेंगे, इसको इसको दोबारा करो सी ब्रेक कर दिया, खांसी करो आप तेज से करनी, अब तो आप हल्के हो गए। तेज से सी ब्लड केम बट नाउ। मैम खांसी करो एक बारी, दोबारा दोबारा करना, दोबारा से तेज से कंटिन्यूस do the vein is inside as soon as the जैसे ही पेशेंट अगर बोलेंगे ना तेज से ना, अब क्लॉटिंग हो चुकी है इस कंडीशन में ना, सो अभी इसमें ब्लड नहीं आ रहा। सो ऐसी कंडीशन में क्या होता है, अगर ब्लड आ गया और यू नो कि जैसे अभी जो हमारी निडल है वो अंदर वेन में है, सो इस कंडीशन में हम लोग क्या करेंगे, वील अप्लाई अ 10 ml सिरिंज एंड देन टेक इट आउट, तब उससे हम सक करेंगे। सो दिस इज़ द ईजीएस्ट प्रोसेस इफ़ अगर क्या कहते हैं ब्लड नहीं आ रहा है, बिकॉज आप 18 नंबर की या 16 नंबर की निडल यूज़ करोगे तो पेशेंट के लिए बहुत पेनफुल होता है। तो बेटर क्या है, यूज़ दिस कैल्फिन सेट। और अभी क्या है कि अभी हमने करा बट ज़्यादा भी हम इनको नहीं देंगे स्ट्रेन, सो विल जस्ट रिमूव इट। अभी क्या करेंगे, यहाँ पे कॉटन रखी हमने, इजीली इसको बाहर खींच लिया। सी ब्लड आया बट यू कैन सी द क्लॉटिंग फैक्टर, ब्लड हैज़ क्लॉटेड, इनका ब्लड बहुत जल्दी क्लॉट कर रहा है।
Is there any chance for heavy bleeding?
I have not seen it, but heavy bleeding can happen, but you can easily control. Only a small prick is there. See, any bleeding is there after he pricked? No bleeding is there. This is the same because the clotting is very fast, so it is not bleeding. If I would have done, if the patient has walked little bit and then, so you can take or tell the patient to fold his or her legs and do then also vein will come out. If someone, I guess her vein was also not that much prominent,
both sides should करना,
you can do both side, इधर भी कर सकता है।
एक समय में दो नहीं चाहिए?
नहीं, अगर यहाँ पे आपसे प्रिक नहीं हुआ, ठीक है, और आपको लगता है कि ज़रूरी है, because if you have pricked for one time and blood is not coming, you can go for to prick it on another side. It's not your mistake. The vein or the blood is too much thick that it is getting clotted. That's why it's not getting out. So you don't, अभी मतलब इस चीज़ में क्या है ना, आपने इसमें घबराना नहीं है। So
नहीं चाहिए,
इधर विद कैसे कर सकता है, इट्स रिस्की बट डूइंग सेरावेद। मैम एक बार दोबारा से करेंगे, करूँ, प्रिक नहीं करूँगा। सी इधर वेन ही लोकेट नहीं हो रही है, बट हेयर वी कैन फाइंड द वेन, राइट। अभी समवन लीन, कोई पतला बंदा है यहाँ पे जिसकी वेन्स विजिबल हो, आई विल शो। अपनी टांगे फोल्ड कीजिए सर, लेग्स फोल्ड, हाँ। अब देखो वेन कितनी इजीली अवेलेबल है। अब हम पेशेंट को बोलेंगे करो, तेज से तेज, खांसी करो तेज से और तेज, वेन इज विजिबल सर करना है सी वेन इज easily visible. If you are having problem, 2-4 पेशेंट की कैनुला लगाना सीखो शिपर पे और पैरों पे कहीं पे भी, और जब सीख जाओगे उसके बाद इजीली यू नीड टू ऐसे फिंगर आपने यूँ रखी, यहाँ से खींचा और इजीली आपने डालना. बहुत इजी है जुगलर में छेद करना, बहुत इजी है और हर कोई नहीं करता है. अगर आप में से 5-7 लोगों ने भी करना स्टार्ट कर दिया, इट कैन ईजिली क्योर ऑल उर्द जत्रुगत विकार. दिस इज द ओनली प्लेस वेयर यू कैन विन और द उर्द जत्रुगत विकार. सी, और दूसरा हम क्या कर सकते हैं, अगर मैं इधर से आ जाता हूँ यहाँ से, सी आई हैव ब्लॉक द रूट ऑफ द नर्व. ये अब ऊपर से वैसे अच्छी सी दिख रही है. सो टेल समवन हु इज असिस्टिंग यू टू प्लेस देयर फिंगर इन दिस वे. इजीली प्रिक हो गई है. अब क्या होगा, जब हम इस वेन पे प्रिक कर रहे होते हैं, मोस्ट ऑफ द टाइम क्या होता है, जब आप प्रिक करेंगे तो वेन इधर उधर भागती है. उसके लिए आपने क्या करना है, इसको थंब लगा के ऐसे पुश करके रखना है. सो अब वेन स्टेबल है, वेन इधर उधर नहीं भागेगी, इंस्टेबिलिटी नहीं रहेगी वेन की. सो दिस इज द मेन थिंग. और इफ समवन इज हैविंग हेडेक और एनी और जत्रुगत विकार, वी कैन गो फॉर दैट. सर आप इधर से आइए, इधर आप अपना हैंड रखें. कैन एनीवन ओपन द फ्लैश फ्रॉम हिज फोन. यहाँ से ऐसे रख देंगे, ठीक है. रखिए, आप हाथ रखिए, कर दे सर. है नहीं, यस और नो. यस स्पिरिट.
Can you try?
बस हाँ. अब गलती क्या होती है कि हम इसको अपनी तरफ खींचते हैं. हमने खींचना नहीं है, हमने इजीली बस इसको ऐसे लगा के रखना है. नो प्रेशर टूवर्ड्स द पेशेंट. एंड फ्लैश कहाँ से ऑन करके रखेंगे, इधर से ऊपर से. सी, खांसी करो. सी, टांगे फोल्ड. तेज से आ करेंगे, ठीक है. अगर ब्लड नहीं भी आया तब भी कोई दिक्कत नहीं होगी. तेज से खांसी करो. हाँ सी, बीच बीच में करते रहो. खांसी. So how many of you will try this in future? You will surely try because आपने करवाया है तो आप करवाओ, सब करवाओगे. Praveen Joshi sir made me as a sample to do this, and from the very next day I started doing Siraveda from jugular vein. See.
What are the main generation indicated in this?
It can be done in all Urdu Jatrugat Vikar, where the involvement of Pitta and Rakta are there.
Any contraindications of
सुकुमार
migraine condition?
माइग्रेन में बहुत अच्छा काम करता है, बहुत अच्छा.
In high BP patients, sir?
High BP patient you can take it, or you can take blood from cubital vein, middle cubital vein, left side. See, अभी निडल को निकालेंगे से बहुत ज़्यादा ब्लड नहीं निकाल रहे हैं अभी पेशेंट का, बिकॉज ही डोंट हैव एनी प्रॉब्लम. सो इधर क्या करेंगे, इधर कॉटन को रखेंगे, हल्का सा प्रेस करेंगे. प्रेस करने के बाद निडल को हम ऐसे खींच देंगे. डन. एंड विल डिस्कार्ड this scalp vein set according to BMW norms. So we should be having all the B&W norms in our clinic. See. अब मैंने यहाँ पे कॉटन रख के रखी, 1 मिनट 1.5 मिनट के लिए कॉटन रखेंगे, बट दिस इज़ कॉटन विद स्पिरिट. सो स्पिरिट वाली कॉटन अभी हम यहाँ पे नहीं रखेंगे, वील टेक ओनली प्लेन कॉटन विदाउट स्पिरिट. सो अभी वहाँ से हम कॉटन उठाएंगे और वो रखेंगे. सी छोड़ देंगे सर. सी एनी ब्लीडिंग इज देयर? नहीं. सो इट इज़ दैट सिंपल. We didn't take out more blood.
Sir, minimum which quantity should be taken?
10 ml can also work. This will also work. कभी कभी पेशेंट्स में क्या होता है कि इतना ही ब्लड आता है और उसके बाद क्लॉटिंग होनी स्टार्ट हो जाती है. तो ऐसी कंडीशन में हम लोग क्या करते हैं, इतने ब्लड में भी पेशेंट को रिजल्ट मिल जाता है. So now what to do, we'll just cover this needle and then discard it. Sir, you can get up और अभी आराम से उठना है. फिर जब पेशेंट उठ जाता है तो पेशेंट से हमेशा हम पूछते हैं कि भाई आपको चक्कर तो नहीं आ रहे हैं, सर तो नहीं घूम रहा है, कमजोरी तो फील नहीं हो रही है. और एग्जैक्टली आफ्टर दैट मधुर अम्ल रस शुड बी गिवन. तो अभी सर को मधुर अम्ल रस देंगे. मधुर तो नहीं है, मधुर रस मिल जाएगा, अम्ल रस नहीं है, बिकॉज चाय तो मिलेगी अभी आपको. कोई अभी अब हम नेक्स्ट हमारा पूरा विद्ध कर्म का और सिरावेद का कंप्लीट हो चुका है. अब आप सब में से सभी लोग शिपर में से सिरावेद कर लेंगे. ऐसी स्कैल्पेल सेट डाल के 50 ml ब्लड कोई भी निकाल सकता है. बाय पंचरिंग शिपर एनीवन ऑफ यू कैन टेक 50 ml of blood on hand also and foot, hasta and path both. Then most of you would be trying jugular vein siraved. And why jugular vein siraved is easy? Because if a patient is fainted also, then also we put central line on that patient. So it is that easy कि अगर पेशेंट बेहोशी की हालत में भी आ रखा है तब भी उसकी हम जुगलर वेन को लोकेट करके वहाँ पे जब सेंट्रल लाइन डाल सकते हैं तो हमें सिरावेद करने में क्या दिक्कत है, राइट? So this is a small thing because if they are allopathic doctors are putting central line on a fainted patient, then also you can go for if the patient is coming in normal condition, patient is having sira shoot, you go for siraved on jugular vein, you will be getting results. So with this lecture of Siraveda and Viddha Karma is completed. Now after a tea break, we'll go for with cupping therapy and Sandhi Sandhan Chikitsa. But theoretical part we'll go very fast. Then we'll go for the practical part itself. And in that cupping also we have got something for you. In that also you will all will do hands-on training of cupping, right? So now we have completed with Viddha Karma and now we'll be starting with the Alabo Chikitsa lecture. So and we are also having a shortage of time. So I told around half an hour you have. So half an hour or 1 hour? 1 hour. We'll try to complete within 40 minutes. So theoretical part in my PPT I have written every theoretical part in detail. So I'll just move fast with the PPTs and then we will directly go for the practical part, because practical parts pratyaksh is also necessary. Theoretical part you can read it from the PPT itself, right? So anyone of you and how many of you are doing cupping there itself in your clinic? And only that blood cupping or static cupping? Gliding also? Dry cupping? Only dry cupping? Dry and blood. So we'll be discussing about the different types of cupping. And cupping, how I learned, I was going through Raktamokshana. Then I read about Alabu and Ghatik. So there's a problem with me. Whatever I study, I practically imply that. मैं हर चीज़ जो भी चीज़ अगर कुछ पढ़ता हूँ तो उसको ना पहले सोचता हूँ कि पहले इसको प्रैक्टिकली करके देखूँ कि होती भी है या नहीं होती है. सो एंड उसी की वजह से कपिंग मैंने करनी स्टार्ट करी और उसी की वजह से बर्न मार्क भी है मेरी थाई में. आई ट्राइड कपिंग ऑन माई सेल्फ विद दिस. दिस वॉज द वेरी फर्स्ट थिंग विच आई यूज्ड फॉर कपिंग. आफ्टर दिस that lung cap jar जिसमें आजकल नमकीन वगैरह भी keep it. So then I start using them, and for around 1 year I only use that, and with that itself I treated around 300 patients, one patient daily, and other 65 days were for my roaming here and there. Even when I was roaming here and there, I was getting patient there itself, and I was doing all the procedures. So then what is cupping and कहाँ से evolve हुई है? आयुर्वेद से या चाइनीज से? रेफरेंस अशुद्ध संहिता में. So the cupping evolved from our Ayurveda itself, and it was written as Shringi, Alabu, Ghate. So Shringi का modern example क्या है? Has anyone saw doing Shringi? No one. Shringi is the commonest thing which you can find in villages of North India. There are many that only normal people, those who are famous with the name of Shringi Wala, they come and they take that horn and they apply. And even I have learned Shringi from them itself. No one knows how to do Shringi. So I have learned Shringi from them itself. And most of the doctors even call them correct, but even Ayurvedic docters जहाँ पे श्रृंगी जो आयुर्वेद का पार्ट है वो आज आयुर्वेद के डॉक्टर्स उनसे ही सीखने जा रहे हैं. Why? Because एक देखना था कि how to do श्रृंगी. So they apply a blade, surgical blade on a artery forceps, or they are having different type of instrument for that. That is made up of wood or steel, and they tie a blade in front of that. And first they apply the shringi, they apply like a horn. So this is modern shringi. What they did, apply it, then suck it, make the area of that shringi, and just by tapping, only 3 or 4 taps with that surgical blade, and then they again apply that shringi with them and suck it with their mouth, and ऊपर what they did, आटा लगा देते थे. So that was the thing what they were doing. And right now which we are using on the name of shringi is wet cupping or blood cupping. So this is the our shringi which was evolved by China, and they designed this cup. So even उसके बाद मेरे को भी कि अगर पड़ा है तो बना के भी देखूंगा. Then I went to various cattle farmers. So from them I got a horn, and then I also tried that shringi, but only with single 2 taps. Little bit of blood came, but patient got result in that. And not by cleaning. I take a sandpaper, I just rub it all the way. I made it very smooth, then varnished it, and then I use it on the patient. But nowadays, because of hygiene and maintaining all the ethics of our Ayurveda, this is the best thing. So you are using this cup and throwing it on the dustbin or reusing it? Reusing. This cup cost, आपको कितने का पड़ता है ये कप? 900. This cups cost only 20 to 25 rupees only. Only one cup is costing 20 to 25 rupees. You can easily take it from here. The wholesalers are there in Delhi itself, and they courier itself. And even I am also getting it from the wholesaler. He gave me when I am taking 1000 to 2000 cups, he is giving me for 18 rupees. And when I buy 10 to 20 cups, maximum I have given even from a normal shop is 25 rupees. And if we are ordering it in bulk, you can even get it for 15 rupees. That's it. This is the only cost of that cup. Only 20 to 25 rupees is the maximum cost. So you can discard these because of the hygiene and proper. If the patient is of HIV and you have used that cup, you have sanitized that cup and used it on another person, you are indirectly giving an infection to the patient. So what we do, we charge 100 rupees per cup minimum. Sir, you can charge it from 100 to 500 per cup. And You can use 5 cup also, 10 cup also, depending upon the condition. So this is the cup which you can use. Minimum cost, if you are charging 100 rupees, then also there is a profit of 75 rupees. And for the procedure you can charge another thing. Then moving on to another cup. This is a glass cup, and this is the head, this is neck, and this is body. So I'll tell you about how Alabo was used, and this is the modified form of Alabo or Ghatik Yantra, and this gives very good results while working in an OPD in a small OPD. I started with cupping, and using this cup only I gathered patients. So I modified it according to the patient. I did cupping also. Then we added Chaman also, Shodan also, and different types. But when I started doing my practice, I started only with the cupping, and even with that lug cap jars. That's it. So this is also easily available in Amazon. But depending upon the quality, there are 2 types of cup which is easily available, because you will be ordering after seeing this. So one cup which is available, it is for 1000, and one cup which is available, it is for 25,000 to 2500 to 3000. So always try to buy only that 2500 or 3000 cup which price, जिसका प्राइस 3000 या 2500 रुपए है, because जो 1000 रुपए वाला कप है that is easily available for 500 in the normal shops, but that cup will break within a month. Total set will break in a month, and I am having a cupping set and I am using that from past 8 years. और वो अभी तक वैसे का वैसा ही है. कप नीचे गिरने के बाद ही टूटा है, उससे पहले तक अभी तक कोई कप नहीं टूटा है. And once one of my friend got it from Amazon for 900 rupees, and his whole set broke up in a month with excess heating. So imported cups which are coming from China are good. हर Chinese माल खराब नहीं होता. So let's move on to the next. So what is cupping? उसको हम डिसाइड करेंगे. कपिंग आयुर्वेद का है, चाइनीज मेडिसिन का है, इज इट मायोफेशियल डिकम्प्रेशन और इज इट हिजामा? व्हाट इज इट? Everything is same. The techniques are different. It originated from Ayurveda. It has its reference in Ayurveda. Then Chinese people took it. Then it went to other European countries also, and then it went to states also, United States also. Then there was different type of inventions by different doctors. तो आयुर्वेद में हमें बोला गया ना कि आपने पूरा शास्त्र भी पढ़ लिया, तो अगर आपको कुछ लगता है कि ये करना चाहिए या कुछ नया इनोवेशन करना चाहिए तो आप कर सकते हो. शास्त्र उन्होंने बना दिया है उनके लिए जो उसको पढ़ के अपनी प्रैक्टिस को आगे कर सके, बट उन्होंने ये नहीं बोला कि आप कोई नया इनोवेशन नहीं कर सकते. आप अपनी प्रैक्टिस के लिए कोई भी नए इनोवेशन फाउंड कर सकते हो, राइट. सो आयुर्वेद में रक्तमोक्षण या फिर अलाबो चिकित्सा बोला जाता है कपिंग को, और ट्रेडिशनल चाइनीज मेडिसिन में इसको कपिंग थेरेपी बोला जाता है. क्लियर. देन फिर उसके बाद यूनानी में इसको हिजामा बोला जाता है. आफ्टर दैट यूनाइटेड स्टेट्स या उस अमेरिका वाले एरिया में, कनाडा वाले एरिया में भी इसको कपिंग थेरेपी बोला जाता है. और दूसरा इसका नया इनोवेटिव नाम जो आया था, इट वाज अ डॉक्टर हु वाज फ्रॉम कनाडा एंड यूएसए. उन्होंने इसका नाम मायोफेशियल डिकम्प्रेशन दिया था. एंड देयर वाज आल्सो अ डॉक्टर फ्रॉम रशिया who also named this as myofascial decompression. Then moving on, what is cupping? So cupping therapy is a technique that involves the use of various materials such as bamboo, plastic, glass, silicone, cups to create vacuum effect on the skin. Plastic I have shown you, glass I have shown you, and this is another innovation by Chinese people. This is bamboo cup. And other cup which is ceramic cup, जिस कप में आप लोग चाय पीते हैं, that cup is also used for cupping. And then silicone cup, और silicone cup के साथ स्टोरी ऐसी है कि I told silicone cup is used for facial enhancement. Beauticians उसको यूज करते हैं. तो घर में I told कि मेरे को cupping set मंगवाना है at that time, so I need money for that. So at that time the whole kit costed me around 13 to 15,000. I told them कि आपका फेस सुंदर हो जाएगा उससे, and I started doing that beauty cupping on my family, on my mother, on my masi. So from that I got my set completed, and then I started doing proper cupping. So after that the vacuum generates suction. ठीक है, जो आपने वैक्यूम लगाया है वहाँ पे जो कप लगाया है, it will generate a suction and pulling effect on the skin and on underlying tissues, right? Negative pressure आ रहा है, so इससे क्या होगा, वो blood circulation वहाँ पे increase हो जाएगा. जब blood circulation increase होगा तो ऑक्सीजन रिच ब्लड की सप्लाई बढ़ेगी. अब ऑक्सीजन रिच ब्लड की सप्लाई बढ़ रही है तो न्यूट्रिएंट्स भी आएंगे वहाँ पे. ठीक है, अब उस कंडीशन के बाद हम लोग क्या करेंगे, when we remove that cup there is a negative flow or flush out of that blood. So when the flush out of that blood is there, that will flush out all the pain receptors, है ना. और मसल टेंशन रिलीव करते हैं, स्टिमुलेटिंग नेचुरली. उससे क्या होगा, मसल की जो टेंशन है वो कम हो जाएगी और हीलिंग को बढ़ाएगा वो, और इन्वॉल्विंग ओवरऑल वेलबींग, राइट. सो नॉर्मल पर्सन के भी कर सकते हो. स्पोर्ट्स कपिंग कैन बी डन ऑन नॉर्मल स्पोर्ट्स पर्सन ऑल्सो. इवन आई एम अ स्पोर्ट्स पर्सन, तो मैं हर महीने तो एटलीस्ट ट्राई करता हूँ कि क्लिनिक से अगर थोड़ा सा टाइम मिल जाता है, देन आई विल गो फॉर लिटिल बिट ऑफ डायनामिक कपिंग एंड स्टैटिक कपिंग. So mechanism of cupping is also the same. The pain is here. We apply cup by sucking action. It will create a negative pressure, increase blood flow in the capillaries. Then we'll remove the cups, and after that blood flow will be there in opposite direction. और pain causing messengers जो हमारे होते हैं, different types of pain causing messengers are there, like serotonin, nociceptors, prostaglandin. वो flush out mechanism के through capillaries से बाहर चले जाएंगे. आफ्टर दैट क्या होगा, ऑक्सीजन रिच ब्लड की सप्लाई वहाँ पे बनेगी. ऑक्सीजन रिच ब्लड वहाँ पे आया है तो वो ऑक्सीजन रिच ब्लड जो है लिटिल बिट ऑफ इन्फ्लेमेशन कॉज करेगा उस एरिया पे, और वहाँ पे जो इंजरी हमारी हो रखी होगी उसकी हीलिंग स्टार्ट हो जाएगी. दिस इज द बेसिक मैकेनिज्म ऑफ कपिंग. सर ये स्टार्ट. सो आयुर्वेद में बहुत सारे रेफरेंसेस आते हैं कपिंग के ऊपर और डिफरेंट चीज़ों के ऊपर. तो अब डायरेक्टली हम स्टार्ट करते हैं. मैं बताता रहता हूँ आपको बिकॉज टाइम कम है. तो डिफरेंट टाइप्स ऑफ कपिंग कौन कौन सी हो सकती है, ठीक है. एक ड्राई कपिंग होती है, देन वेट कपिंग होती है, देन फ्लैश कपिंग. फ्लैश कपिंग इज मसाज कपिंग ऑल्सो जिसे हम कह सकते हैं. फिर बेस्ड ऑन पावर ऑफ सक्शन, लाइट, मीडियम, स्ट्रॉन्ग. देयर वाज अ डॉक्टर हु हैड अ कपिंग सेशन और उनके इतने ज़्यादा पंच मार दिए थे कि उनके वहाँ पे ब्लिस्टर्स बन गए थे, और इट इज़ बीन 1 ईयर. उनका अभी तक जो कप मार्क है वो अभी तक हील नहीं हुआ है. सो पावर ऑफ सक्शन भी आपका मैटर करता है. देन मेथड ऑफ सक्शन, दैट यू आर यूजिंग फायर और मैनुअल विद अ गन और इलेक्ट्रिक कप्स आर ऑल्सो अवेलेबल, ठीक है. फिर एप्लीकेशन ऑफ कप, इज इट कपिंग डायनेमिक. डायनेमिक मतलब लगाया कप को और हटाया. देन स्टैटिक, you have only applied the cup, which is called dry cupping, right? And then gliding, you have applied the cup and then you are moving it. And based on suction techniques, dry cupping, which is static cupping, wet cupping, which can also be called as rakta mokshan, then flash cupping, which is rapid cupping or fire cupping, which stimulate dynamic blood flow. Then moving cupping, gliding cupping. इसको हम दो चीजों में यूज कर सकते हैं. We'll follow the muscle pathways in gliding cupping, and then we can also follow the nerve pathways in cupping. In घुद्रुसी के केस में हम gliding cupping का अगर यूज करते हैं तो it gives good results, है ना. बट in case of muscle tear हो रखा है, उसके बाद muscle healing start करवानी है बहुत gentle pressure के साथ, we also follow the pathways of the muscle. So next it comes to based upon the materials used, what type of material you are using. One is glass cupping, which I have already shown you. Silicone cupping, जिससे मैंने अपना cupping set बनाया था. It's been 9 years. So after that plastic cupping, then bamboo cupping, and after that ceramic cupping is there. So different types of cupping. then based on techniques used, based on power of suction, based on method of suction, based on application of cups, based on suction techniques, and after that based on material used. Right? After that, based on modern variation, magnetic cupping, it's a new innovation, even I have not used that. And electric cupping by using electric pumps, and water cupping, that is hydro cupping, and then fire cupping. Water cupping is used by Russian physiotherapists, and physiotherapists in China also, they take water or they take the cup and put 2 ice cubes on the inflamed area, and they are also using that in acute condition. But still, I am also trying to find why they are using ice and with cupping in acute condition. Then based on the therapeutic purpose, sports cupping, detox cupping, and reflexology cupping. And reflexology cupping के बारे में I don't know anything. It comes in the topic. Then also I have added. I have never done reflexology cupping. Then different types of cupping and what are the benefits of that cupping therapy. So you will get the PPT of this. Then it comes to indications. Different indications are told, and it's there in PPT, so we'll skip this part. On musculoskeletal disease, which you can use, then in acute and chronic condition, which you can use, then on neurological disorder where you can use. After that, moving to hair and skin disorder where you can use cupping. Then blood circulation disorders, रॉल्स डिजीज में कंडीशन डिपेंड करती है आप कौन से रॉल्स डिजीज में कपिंग का यूज कर सकते हो. हर रॉल्स डिजीज के कंडीशन केस में आपको कपिंग नहीं करनी है. वेरिकोज वेन में भी अगर थ्रोम्बोसिस हो रखा है उस एरिया में, तभी आप तब वहां पे आप कभी कपिंग मत करना. थ्रोम्बस अगर हो रखा है तो उस एरिया में कभी कपिंग मत करना. देन मेनोपॉजल डिसऑर्डर्स and autoimmune conditions. After that, moving on to contraindication, and first is never do cupping. So only thing take home message is never do cupping, blood cupping on hemophilic patient, or on never do normal cupping also on hemophilic patient. You have different things to do, but hemophilic patient के केस में complications हमेशा आती है cupping करने पे. और हार्ट डिजीज, ब्लड क्लॉट्स अगर हो रखे हैं, डीप वेन थ्रोम्बोसिस हो रखा है, तो उस केस में कभी भी कपिंग मत करना. और प्रेगनेंसी एंड स्किन कैंसर, I had a complication on a patient who was having deep vein thrombosis, but anyhow the complication subsided. I did her a scan also and all the diagnosis also. At that time she was not having, but some or the other how she developed a problem, and her foot turned out to be red and then blackish. That thing subsided in a week, but that gave me a little bit more, मतलब मेरे को बहुत दिक्कत हुई उसको मैनेज करने में 1 हफ्ते तक. then 1 हफ्ते बाद वो easily manageable हुआ. Then different contraindications of cupping or absolute contraindications are there. Then different relative contraindications are there. After that, contraindications of wet cupping, and hemophilia के patient में आप कभी cupping मत करना, and severe anemia, never do it in that condition. Blood cupping, because वैसे ही उसके अंदर खून कम है, आप और खून निकाल दोगे तो दिक्कत तो बढ़ेगी, right? And after that, general contraindications of both, like severe fear, अगर किसी को anxiety किसी को cupping से, तो ऐसे केस में कभी कभार दिक्कत हो जाती है. और extreme dehydration के केस में cupping नहीं करनी है हमने. And potential side effect, cupping every individual में आपने easily करनी है, but it can cause bruising also, some blisters also on the patient, and can damage the skin also. Like I've shown it in the next slide. First we'll discuss about the materials required. We are using glass cup, plastic cup, gun for plastic cup, burning spirit, morivina, cotton, sponge holding forceps, lighter, gloves, 2 towel and draping sheet to cover the rest of the body part, right? These are the lakshana of atiyo. This can happen by doing 5, 6, 7 punch. And this was the same case where yesterday we met a doctor who had this atiyo of cupping, and this damaged skin, the skin peels off, and it takes around 2 to 3 months to heal. but the scar of that cup will remain for around 1 to 2 years. Even I'm seeing a patient from past 2 years who is having the scar right now. Someone did his cupping by 6-7 punch with more pressure, so this happened. And that one is also doing a yoga of cupping, applying too much of cup on the back, it won't give any results. Then these are the Samyog Yoga. These are Samyog Yoga of fire cupping. These are Samyog Yoga of blood cupping. These are Samyog Yoga of normal vacuum cupping, dry cupping. Done. So with this, our slide is theoretical part of cupping is completed. Now we'll go for a short theoretical part of Sandhi Sandhan Chikitsa. Then we'll go for the main practical part. Sandhi Sandhan Chikitsa, anyone can tell me? So in Sandhi Sandhan Chikitsa, taking that Sandhi back is simply Sandhi Sandhan Chikitsa. Where did it come? भग्न जब हम पढ़ रहे होते हैं तो उसके बाद में संधि मोक्ष की चिकित्सा बताई गई है, वहाँ पे हमें डिफरेंट रेफरेंसेस मिले हैं. एंड वाई और संधि संधान चिकित्सा को अगर आज की डेट में देखें या हमारे एरिया में जब हम प्रैक्टिस करते हैं तो इसे संधि संधान क्यों कहा जाता है या कायरोप्रैक्टिक हम क्यों नहीं कह रहे हैं. सो इसके साथ साथ हमने बहुत सारी और डिफरेंट चीज़ें भी ऐड करी है. तो उसमें हम क्या करेंगे, उसमें संधि संधान इसलिए हमने उसमें ऐड करा है. तो डिफरेंट बोन्स है, जॉइंट्स हैं, स्पेशली जॉइंट्स है कि अगर उनमें कुछ एनाटॉमिकल डिफेक्ट आया है तो हाउ विल वी एडजस्ट दैट, राइट. सो बहुत सारे हमें संहिता में रेफरेंस मिलते हैं डिसलोकेशंस के. देन संधि मुक्त के लक्षण हमें मिलते हैं. आफ्टर दैट संधि मुक्त के लक्षण आचार्यों ने बताया है कि किस किस तरीके से संधि मुक्त हो रखी है, कि हाउ द संधि इज डिस्प्लेस्ड फ्रॉम इट्स प्लेस, राइट. आफ्टर मूविंग ऑन टू दैट आचार्यों ने डिफरेंट टेक्निक्स बताई है दैट हाउ कैन यू एडजस्ट दैट संधि. एंड the other thing which the chiropractic which we are using is just because of that yukti. और if you are going to the tikas, उसमें भी आपको एक रेफरेंस मिलता है कि अगर आपको संधि संधान के लिए बोला गया है तो ऐसा नहीं है कि आपको क्या कहते हैं पूरी संधि प्रॉपर डिसलोकेशन हो रखा है तभी आपने संधि संधान करना है. जब एनाटॉमिकल डिफेक्ट्स आ रहे होते हैं तब आप उसको भी कुछ संधि संधान की टेक्निक्स यूज करके एडजस्ट कर सकते हो. सो वैसे अभिजीत सर के साथ हम थे तो तब हमने ये वाला क्वेश्चन उनसे पूछा कि सर वाई इज दिस, क्योंकि संहिता को और टीकाओं को इतनी डेप्थ में सिर्फ उन्होंने ही पढ़ा है. तो उन्होंने रेफरेंस दिया था हमें और उन्होंने बताया था कि आप डगन में या और टीकाएँ जब पढ़ोगे तब आप इस चीज़ का मतलब समझोगे कि संहिताओं में बहुत संक्षिप्त में लिखा गया, बट जो हमारे टीकाकार है टीकाकारों ने उनको एलेबोरेट करा. फिर उसके बाद जिन्होंने उन टीकाकारों को अच्छे से पढ़ा, सारी टीकाओं को अच्छे से पढ़ा, उन्होंने भी सोचा कि चलो अब हम एलेबोरेट करते हैं. सो टीकाओं को भी एलेबोरेट डिफरेंट तरीके से किया जाता है. देन हाउ टू एडजस्ट डिफरेंट टाइप्स ऑफ संधि, लाइक शोल्डर डिसलोकेशन. जीकू सर को मैं सबसे पहले तो जीकू सर सामने बैठे हैं और सर को और सुरेश सर को सामने थे. और मैं सबसे पहले ये बोलूँगा कि सर ने एक बहुत अच्छा हमें टेक्निक बताई है हाउ टू डू डिस्प्ले शोल्डर डिसलोकेशन को आपने कैसे ट्रीट करना है. अर्लियर मैंने शोल्डर डिसलोकेशन ऑर्थोपेडिक डिपार्टमेंट में भी हम काफ़ी टाइम रहे हैं. सो उसमें क्या हमने शोल्डर डिसलोकेशन देखे भी हैं और ट्रीट होते हुए देखे हैं, बट सर गेव अस द मेन आइडिया हाउ विल यू फिक्स दैट डिसलोकेटेड शोल्डर. सो आई वुड रिक्वेस्ट सर इफ अगर इसके बाद सर एक बारी जरूर आप सबको बताएं दैट आयुर्वेदिक वे में आप डिसलोकेटेड शोल्डर को कैसे एडजस्ट करेंगे. आई एम ऑल्सो यूजिंग दैट टेक्निक, बट दैट इज मॉडर्न टेक्निक एंड सेम ही है बट थोड़ा सा डिफरेंस है. बट इसके लिए मैं स्पेशली जीकू सर को रिक्वेस्ट करूँगा कि इस लेक्चर के बाद जैसे ही मेरा थ्योरेटिकल पार्ट खत्म होगा, कपिंग स्टार्ट करने से पहले सर एक बार आप लोगों को शोल्डर डिसलोकेटेड शोल्डर फिक्स करना सिखाएं. After that, moving on to wrist, elbow, knee joints and ankle joints. There are different ways of adjusting. After that, hip और hip joint, femur cervical pathologies और temporomandibular joint को भी adjust करने की different techniques बताई गई है. So depending upon the condition और आप बार बार जैसे जैसे try करते रहेंगे तो उससे आप संधि संधान कर सकते हैं. और उसके बाद भी अगर क्या कहते हैं dislocations हो रहे हैं तो आचार्य ने proper detailed version हमें दिया है शास्त्रों में. और कॉन्ट्रा इंडिकेशंस क्या है? सर्वाइकल स्पाइनल फ्रैक्चर्स में आपने नहीं करना है, या डिसलोकेशन अगर हो रखी है तो कंडीशन को देखते हुए ही करना है. डोंट डू इट कि इफ यू गेट अ पेशेंट उसके डिसलोकेशन हो रखी है एंड यू आर डायरेक्टली डूइंग संधि संधान ऑन दैट कंडीशन. रेडियोलॉजिकल डायग्नोसिस इज दैट मच नेसेसरी. आफ्टर दैट सीवियर ऑस्टियोपोरोसिस. सीवियर ऑस्टियोपोरोसिस के केस में मोस्ट ऑफ द चांसेस ये होती है कि बोन ब्रेक हो जाती है, राइट? So spinal infection like osteomyelitis and tuberculosis of spine, then bone cancer, unstable spinal cord injuries, cauda-equina syndrome में थोड़ा सा रिस्की रहता है, and recent history of stroke और vertebral artery disease, right? And different types of contraindications are given कि आपको उन contraindications अगर हो रहे हैं तो लाइट संधि संधान में आप जेंटल ट्रैक्शन टेक्निक्स का यूज़ करना है, डिफरेंट कंप्रेशन टेक्निक्स का यूज़ करना है, और along with आयुर्वेद के आप क्या क्या चीज़ें उसमें यूज़ कर सकते हैं. Then, so Jiku sir, my theoretical part is completed. Now I request you to please let us know about dislocated shoulder. Then we'll proceed for the practical part.
Thank you, Dr. Arjun, for sharing my thoughts. We had a session at Cortical Ayurveda College in this Wednesday. He was attending that seminar, so he asked to do this. Anterior shoulder dislocation. We can divide dislocation into acute and recurrent. Again, acute can again be divided into anterior, posterior, and inferior. Out of this, anterior dislocation is the commonest one. And when there is anterior dislocation, how the patient presents, the attitude of the patient. Patient presents with affected hand supported with opposite hand. And on examination, on inspection, we can see that the normal contour is lost. And on palpation, we can feel the acromion process most laterally. And when we ask the patient to touch the opposite shoulder, it is known as Viddha's test. Patient cannot touch the opposite shoulder. In this situation, we need to take X-ray. X-ray shoulder APV must be taken to confirm the dislocation. To confirm whether there is no fracture associated with this dislocation, radiotuberosity fracture and nephrohumerus fracture. Then we can proceed with the reduction method. Actually, the normal reduction method is one person should give counter traction here, traction along the line of humerus, external rotation, adduction up to the midline of chest, and middle rotation is the reduction method, Koch's method. Now we can learn a new method. Actually, this method is modified Koch's method, or it can be, actually this method is known as Milch method, M-I-L-C-H-E, Milch. And you can see actually this method is added in my book, and also it is added as a QR code video also. You can see the reduction method in YouTube with the help of QR code. Actually, what we are doing is from this position, we will move towards this position. Is it painful or not? How much of you tell this is painful? Or no pain is there? Actually, when we move, the patient resists due to fear of pain. At that time, we must use our vocal anesthesia. Speak to patient, okay, which is relevant, and then move towards this position, and we need to give the traction. Will you please show me the external rotation of shoulder? This is the external rotation of shoulder. This one is the external rotation of shoulder. So we are giving traction. When we are giving traction itself, by giving the traction itself, if it's a recurrent shoulder dislocation, it is reduced. Recurrent shoulder dislocation, patient must avoid this movement, external rotation and abduction. So in this position, it is very easy to reduce, as there is no need of counter traction. Patient also felt much relief. Why? Because the reduction method is gentle. There won't be much pain or pressure to the joint capsule or glenoid labrum. So we can easily reduce it with traction. But if it's a fresh dislocation, acute dislocation, first case, then by just giving the traction, we need to give the external rotation also. You can see that video. I am doing that in a anterior shoulder dislocation patient. So you can see that reduction itself happening at that moment itself, which itself causes complete pain relief. When there is dislocation, the cardinal features of dislocation are severe pain, loss of function, deformity. These three will be reversed immediately after reduction. We need to take the check X-ray also for confirmation, and we need to give 3 weeks immobilization, and then we need to give 6 weeks rehabilitation. So the reduction method is traction and external rotation. By this, it will be reduced. Then we can keep the thumb in the axilla and do adduction and medial rotation. But it is after the reduction method. Actually, this is Dugas itself. With Dugas, we can confirm the reduction is perfect. If the patient can do the Dugas, then there is no dislocation. One more thing, this is very important, very important. When there is partial tear of supraspinatus, or complete tear of supraspinatus, acute injury, patient cannot do this Dugas test. At that time, if you attempt reduction without checking the whether inspection, palpation and range of motion and Dugas, if we do the reduction method, attempt this reduction method in a partial tear of supraspinatus, it will become complete. So only attempt the reduction after proper diagnosis and confirm with X-ray. If we do the reduction method in a fractured case, dislocation along with fracture, it will cause tear to joint capsule, which will be a medico-legal case. So never attempt reduction if there is fracture associated. Okay, thank you.
Patient to lie down and remove the shirt. Any other can do. Those who want to experience cupping, dynamic cupping. Please. हाँ. Full. West also. We are starting with fire cupping and that it is a dynamic cupping oil. Lie down. इसको थोड़ा सा we place it down because if a patient is having a cut tissue, we need to do cupping on lower back itself. L5 S1 it is necessary to do cupping, and then on hip area also, right? And if there is a problem with the knee joint or leg joint, if patient is progressive patient is there, so we'll do cupping on legs also itself, right? Or if someone is having pain in knee joint or knee OA, then we'll go for that, right? So we'll first apply oil, and the hand which we use is the another hand. अगर हम कप इस हाथ से hold कर रहे हैं, तो we'll apply oil with this hand. This you are doing it. You are there in clinic. You don't have any therapist with you or anyone to help you, right? Or if you are having a therapist, he will apply the oil. You can do the cupping, and after practicing for 2-3 months, let the therapist learn the cupping, and you only do other work. Because it is not possible to go for OPD itself and OPD also and doing the procedure on your all around. Sir, can you please put it little bit down? We'll just apply the oil, not maximum, बहुत थोड़ा सा just to remove that friction, to make it a frictionless surface, right? And जब हम ऑयल अप्लाई करते हैं तो पेशेंट को कप लगाते हुए पेन नहीं होता है, बट इफ कप वी हैव नॉट अप्लाइड एनी ऑयल और एनीथिंग, patient will feel little bit of discomfort in that. After that cup arrangement, I'll show you there itself. You can see from by standing, this is a glass cup, right? And how to make a cotton ball for doing cupping. इतना कॉटन लेना हमने, इसको थोड़ा सा तोड़ देंगे, then we'll fold it inwards, ऐसे फोल्ड करा and tight. A big tight roll converted to a very small roll, right? Then we'll take our sponge holding forceps and lock it. Our cupping instrument, cupping handle is ready. And what we'll do on the next go, we can take that plastic boxes for putting the spirit. Actually 100% isopropyl alcohol is advised to burn. but right now we are having only 70%, right? So what we'll do, first we'll take this 70% itself. Another, it is also 70% isopropyl alcohol, but it works little bit better. So we have taken this, and also we'll take little bit of thinner. Thinner की burning speed बहुत तेज होती है, so it can जैसे आप इसको यूज करोगे तो आपका जो कप होगा वो ब्लैक कलर में टर्न हो जाएगा और इजीली ब्रेक हो जाएगा. So it's better to avoid thinner and use 100% isopropyl alcohol. Now what we'll do is, till then we have two sponge holding forceps. Any of you who want to practice making this is the main thing, because इसके छोटे छोटे जो फ्लेम्स होते हैं वो पेशेंट की बॉडी के ऊपर गिर के हार्म कॉज कर सकते हो. बेटर टू बी परफेक्ट इन मेकिंग दिस. सो दिस इज द कॉटन. एनी वन ऑफ यू दोज हु वांट टू मेक कैन ट्राई टू. अब इसको कॉटन को हमने स्पिरिट में डिप करेंगे एंड देन विल रिंस ऑफ ऑल द लेफ्ट ओवर स्पिरिट. राइट सर, लाइटर. I'm having it for the safety purpose. See, अभी हमने कॉटन को बर्न करा. It is not burning that properly, right? And if I am dipping it in thinner, it is burning in a very good way. But you can see that black fumes. So this is that's why we use only burning spirit. It is easily available in paint shop, but right now it was hard to find. So sir got some thinner. Now we'll start with fire cupping itself. We'll take 2 cups with us. Sir, you can hold this. And we always use spirit lamp. Now we have burned this. We'll apply the cup on lateral process itself, not on the spinous process for the very first go. Apply the cup, count for 2 or 3, then remove it. Now the main thing is that applying, putting the fire inside the cup and taking it out. This is the main thing. So what you have to do when you have made this cotton roll, you have to take and it should be parallel to the ground, right? Take the cotton inside and touch the base. Never go it like this. If you are not touching the base, if you are only putting it on this surface, this will got heated up, this will remain cool and it will burn the patient and you won't feel any hotness there. And if you are putting it inside, अगर आप इसको पूरा अंदर डाल रहे हो, then बाहर निकाल के पूरा proper पास ले जाके यूं लगा के फिर हटा रहे हो, so it won't cause any burn to the patient. This is the main key factors of doing dynamic cupping, and it will give very good results on patient. Patient will say कि सर पहली बारी में बहुत आराम आ गया. Muscle pain में it gives a very good result, right? So अभी इसको हम दोबारा से क्या करेंगे, स्पिरिट में और थोड़ा सा अब कप को रिमूव करना भी थोड़ा सा ट्रिकी काम है. आप में से कोई हटा के देखिए कप को. But if you apply the cup and just tilt it, it will easily come out. But if you apply the cup and you are pulling it like this, it won't come out. In that, just लगाया, हल्का यूं tilt करा, it is easy, right? Can we keep this somewhere? बर्निंग अल्कोहल में बंद नहीं होगी, कंटिन्यूस चलती रहेगी. For the very first day, you will just apply the cup with a gentle pressure and remove it. है ना? From up to down. So we have steel cups for you, everyone of you to practice. This can be done on very first day, and after that we have completed 3 rounds, 3 rounds, 3 rounds, 3 rounds. This is dynamic cupping with static flow. Now dynamic cupping with gliding. Apply the cup here, slide it. 1, 2, 3, 4, 5. You can go, and then 1, 2, 3, 4, 5. Done. Then from lateral process towards lateral side of the body. In case of nerve compression, it is a very good thing to do, right? So after this, you have completed on this area also and this area. Okay, we'll do now. We'll go for cupping on spinous process with a very gentle pressure. Never do very harsh cupping on spinous process. Now abhi you can check, everyone can hold this cup feels hot, but if you are touching the tip of the cup, it won't feel any hot, right? So now we again dip it in. Other cup. Should I show it with bamboo also?
Yes.
After that, we'll do it. You will just apply the bamboo in the same way. See, it takes more surface area. So, moving a glass cup or a bamboo in this way can be done after 2 or 3 days of cupping only. Never do it on the first day. Patient will feel more pain. On itself in the night, patient will say, sir, pain has increased in the night. That's why. So, sir, please remove the cup now. Remove. हाँ. So, रखा, tilt करा, easily. रखा, tilt करा, easily. Now these are the safest thing which you can use for the very first go, and now we'll tell everyone will practice this, है ना? See, कप लगाया. So you can feel very much of pressure. And another thing, if you feel more risky, then just place your finger here. Easiest thing. If you feel a bit scared that how will we remove this, you can go for this condition. With a light pressure. But steel cups get heated up very fast, so you need to have 10 or 12 cups with you, right? Glass cup takes time, but on the very first go, you can go with steel cup. So you can. So now you get it. How will you remove a steel cup? How will you remove a bamboo cup? How will you remove a glass cup? Now I'll demonstrate on plastic cup. This is a plastic cup. This is the knob. Most of you are using, so you are very familiar with this. We'll just apply this cup. This is 1 punch, 2 punch, 3 punch, 4 punch, and 5. This is the maximum. After this, if you are going to punch, it will cause blisters. And even in Sukumar Vyakti, 2 punch can also cause blisters. So it's very essential to diagnose the skin type of the patient, then only go for cupping. Just apply the and for gliding, just apply the cup. It can also be done with one punch. It can also be done with 2 punch. Maximum is 2 punch. See. And after that, what you have to do? Apply the cup with 1.5 punch. I only give 1.5 punch. So this can also be done. This is following the muscle pathways, right? If you are applying it here and moving it upwards, you are following nerve pathway. Applying it here and moving it upwards on nerve pathways. So in any disease, if you are if there is a case of radicular pain on arm, then also you can go for cupping on arm with small size. It comes from 1, 2, 3, 4, 5 and then 0 and 6 number also come. Very small cups are also there. So you can apply a cup on the center here itself. If you are applying it for around if you want only static cupping, so just 1, 2, that is enough to apply. No 5, 6 punch won't give you good results. It will only give you bruising. So this is can also be considered as samyak lakshan, but we applied this for a very long time. So you can feel little bit of inflammatory condition is there, but it is still considerable. It is still considerable in samyak lakshan itself. See, who will try? बस कप को जब हम प्रेस करेंगे तो ऐसे दबाना नहीं होता. We have to easily place it on the skin. No pressure inside. Only place it. Do it. आप करो. कोई भी करो. Half punch हुए. This is 1.2 punch only. So this is a full punch. Hold it. 1, 2, 3. So pulling this back will make the cup feel good. चलो आप करो. बस 2 से ऊपर नहीं और स्टैटिक कपिंग आप करो. Put it inside. हाँ properly. 2.5. That's it. Maximum for static cupping is 2.5 pressure punches. Now we have removed it. Then we'll keep this, and now another one will come to do dynamic cupping with sea glass. Right? Proper parallel to the surface of the ground. Take it inside and then apply it. See, if you are using this, so what you need to do is take the fire inside, touch it, and then speed बहुत fast चाहिए इसके. See, और fire जो है पेशेंट से दूर रखनी है ना. और मेन थिंग क्या है, प्लीज़ रिकॉर्ड, ये वीडियो में रिकॉर्ड करना. आप सारे पैरेलल लेके गए और फिर आपने अप्लाई करा. जब आप इसको ऐसे लेके जाएंगे तो वैक्यूम नहीं बनेगा. ऐसे लेके गए, जब सरफेस के पास में पहुंच गए तब आपने टिल्ट करना है, तभी वैक्यूम रहेगा. अगर आप ऐसे लेके जाओगे तो एयर विल गेट इनसाइड. बट इफ यू आर टेकिंग इट लाइक दिस, वैक्यूम विल स्टे. सी, ठीक है, आगे समझ में. सो नाउ आई विल डेमोन्स्ट्रेट लिटिल बिट ऑफ संधि संधान, है ना, बिकॉज आई हैव टू यूज द स्टिक itself. Sir, you can wear your clothes. Can be used for Prudrusi patient itself also, patient with avian, and patient with those who are having NEOA, Janusandhigatvat. So you can use this technique in all the 3 cases, and the patient will get instant result with it. It is only a simple traction technique, but like most of the patient they call me from there, they are outside and sir बहुत ज़्यादा pain हो रहा है, what to do now? So this is the basic technique to tell the patient, do it for 1 month, 2 months or 3 months. Even this helps the patient to avoid all the pains, daily pains, and also जैसे अगर किसी पेशेंट को नी रिप्लेसमेंट के लिए भी बोल दिया जाता है, बट कंडीशन कैन बी क्योर्ड विद आयुर्वेदा. सो अगर इस कंडीशन को हम साथ में करेंगे और साथ में भ्रंगण चिकित्सा देंगे तो ऐसी कंडीशन में TKR या फिर नी रिप्लेसमेंट की जरूरत ही नहीं पड़ती है. राइट. सेम आई टेल यू. वाइफ और हस्बैंड टू डू दिस. होल्ड इट फ्रॉम दिस साइड. ठीक है. अप्लाई होल्ड इट फ्रॉम गुलसंदी itself also and just give traction. Count till 5, leave it. Then again on the other one, give traction, count till 5 and leave it. This gives instant doing 10 times this traction, this sandhi sandhan 10 times in a day और 3 times a day. 3 बार अगर आप करोगे इस प्रोसीजर को तो उसी टाइम रिलीफ मिल जाएगा. बट अगर पेशेंट को घुटरुसी का पेन हो रहा है और इसी टाइम आपने पेशेंट का कॉल आया कि सर क्या कर रहे हैं, किसी रिलेटिव का कॉल आता है कि ऐसा कंडीशन हो रही है, जस्ट टेल द पेशेंट टू गिव ट्रैक्शन एंड होल्ड इट. सो दिस थिंग आई हैव डेवलप्ड इट फ्रॉम माई प्रैक्टिस विच आई एम डूइंग इट कंटिन्यूसली. सो इस चीज़ को प्रैक्टिस करने के बाद आई हैव गॉट ईजी रिजल्ट्स इन दैट. और एल्स for Janusandhi Shul, hold the leg from this side, 2 fingers giving perpendicular pressure on Janumarm or on patella, right? 1 finger on lateral aspect, 1 finger on medial aspect, and then thumb holding patella clockwise and then anti-clockwise. ठीक है. And this 1 2 3 then again 1 2 3 हो गया पूरा. आपने क्लॉकवाइज और एंटी क्लॉकवाइज रोटेट कर दिया. उसके बाद मैक्सिमम ट्रैक्शन देके हल्का सा जर्क देना. दैट्स इट. एंड देन आई डिस्प्ले इट ऑन फॉर द स्पाइन. इसका रेफरेंस ये है कि कमर को आपने कपड़े की तरह निचोड़ के एडजस्ट करना. सिंपल रेफरेंस. राइट. लेटरल साइड टुवर्ड्स मी. अब इस कंडीशन में आप क्या करेंगे, नीचे वाली लेग विल बी स्ट्रेट एंड विल होल्ड दिस. टॉवल को हम ऐसे निचोड़ते हैं ना, राइट. सो व्हाट विल डू, विल पुश दिस टुवर्ड्स दिस. अभी ये वाली पोजीशन तैयार हो गई है. सर विल स्टे, हेड विल स्टे लाइक दिस. ही विल होल्ड दिस हैंड, लॉक हिज हैंड, राइट. दिस वे, होल्ड इट दिस वे, राइट. डन. नाउ this elbow will hold the upper part of the pelvis and this hand will hold the lower part of the pelvis, right. And your elbow will push the shoulder away from you. This elbow will pull the shoulder towards you. Okay. हो गया. ठीक है. ये वाला एल्बो हमें अपनी तरफ पुश करेंगे, ये वाला एल्बो उधर की तरफ पुश करेंगे. बट प्रॉपर एक कंडीशन आ गई यहाँ पे. इसके बाद कोई मूवमेंट नहीं है. सो इन दिस कंडीशन वी हैव टेकन होल्ड ऑन बोथ द पेल्विस एंड दिस हैंड विल टेक कंट्रोल आफ्टर द लंबर जॉइंट. ओके. आफ्टर दिस होल्ड योर हैंड्स, मेक दिस. दैट्स इट. आई सेंड यू द वीडियो ऑफ दिस प्रोसीजर अगेन बिकॉज ये 2 मिनट में सिखाया नहीं जा सकता. बट आई ट्राई टू सेंड सम मोर वीडियोज. आफ्टर वॉचिंग दैट वीडियो 1000 टाइम और 500 टाइम यू कैन इजीली उस साइड टर्न करना. हाँ, बोथ द साइड्स. एल्बो ओनली प्रेशर इज गिवन फ्रॉम एल्बो. होल्ड, लेग फोल्ड, नीचे वाली लेग स्ट्रेट. कपड़े को हमने निचोड़ना है. इधर से एल्बो अवे फ्रॉम यू, इधर से एल्बो टुवर्ड्स यू. और इफ द पेशेंट इज हैवी यू कैन पुट योर लेग इन दिस वे. हाइट ऑफ द टेबल शुड बी 28 इंचेस. दैट्स इट. हाउ डू यू फील इन योर बैक राइट नाउ? आफ्टर दैट एक चीज़ आप और कर सकते हैं. इफ देयर इज अ पेल्विस शिफ्ट और देयर इज एन पैथोलॉजी ऑफ पेल्विस, ये इसका रेफरेंस संहिता में है. यू विल चेक द थंब. अगर किसी का पेल्विस टेढ़ा है तो इस तरीके से आता है. एंड इन दैट कंडीशन व्हाट यू विल डू, मैक्सिमम ट्रैक्शन एंड लिटिल बिट ऑफ जर्क. Done. Hold it like this, both the fingers, one and above, overlapping. Thumb giving pressure towards the patient, fingers giving pressure towards you. That's it. Loose रखना है इसमें, body loose. That's it. It will correct the pelvis. Only one jar is enough, right? So we'll conclude because I have to catch the train. Okay. And then 90-degree angle. Give the pressure from your chest towards the scapula itself in this way. Maximum pressure.
Sir, and for the
Anyone can light.
and sir, for the upper back.
Hold, ma'am. See, hold the cervical and take skull in your control. Cervical and skull is in my control. Then remove the specs. Maximum rotation of the neck. इसके बाद कोई movement नहीं है. So my hand is supporting TMJ also and skull also. Maximum little bit of jerk. Every time आवाज will not come. That's it. And another traction which can be easily given to cervical patient. Hold it from this way and hold it from back and little bit of traction. That's it. उसी time pain खत्म. Put it like this. We'll hold this muscle. Push it like this and give pressure from our elbow. In this way. Another one. What we do. From here we give pressure towards us and we just and along with that vision is very necessary in Basti because it will not even get without Basti you won't get this. And addition is required. After
ആയുർവേദത്തിൽ വരുന്നതാണോ?
Sorry.